sought after by the worldwide, and patients travel from across the globe to experience his artistry. Despite receiving prestigious honors from the President of India and Mauritius and being recognized on platforms like Fox News and ZTV, he remains deeply committed to his craft. From celebrities to burn and acid attack survivors, he treats every patient with the same passion and dedication. So today we welcome him to the online summit. And we are not just meeting a surgeon, we are meeting a true innovator in aesthetic medicine. Great warm welcome to sir. Over to you, Dr. Arvind, please. So you can please unmute yourself. But unmute yourself. So you can unmute.
Yes, now. Good afternoon. Now you can hear me?
Yes.
Thank you very much for inviting me. And
Pleasure.
so we will start my presentation if you want. That is how
Yes,
it is.
I'll share the screen. Right.
Thank you.
Thank you. इनको करना ना स्लाइड शेयर play from start. Right.
Yes, thank you very much. So I'll begin gene biohacking therapy for hair growth. There is a concept which we have to understand. When we try to give gene biohacking therapy. It is a science-backed approach to reversing hair loss and monitoring treatment using biological age test. Why biological age test and what all science? That is what I'll be talking about. Can I change the slides or will you change them? I am not able to change on my side. So we have a conflict of interest, first of all, because I have a company, Live Natural Products Private Limited, that specializes in providing anti-aging and gene therapy products for doctors as well as patients. Remember, my interest was not in selling these things. These were not available in India, and many of them are still not available widely around the world. So if you are interested in using them, definitely you can see that. Huh? So now we'll go, once the conflict of interest is cleared, I can go now. So next slide will go. Next slide, please. No, yes, thank you. So first of all, we have to start rethinking baldness. Baldness is not an illness. And it is not only genetic. Every time every patient goes and every doctors tell them your grandfather was bald, so you will turn bald. So they also give up their hands, right? No, previous slide, please. I haven't finished. Previous one. Yes. Yes, this one. Huh? Now remember, if baldness were only genetic, children of bald men would be born bald. That is how the eye color is transmitted, if you have to say it purely genetic. Now, when children are not born bald, what does that mean? That means that the genes of hair loss are silent in everyone when you are born. So if they are silent, very good. But then there comes a time when people unknowingly activate their own hair loss genes and then they start losing hair. You'll often find patients coming and saying, I lost my hair, I started losing them at 20, 25, but my father lost or grandfather lost when he had become old. They are forgetting it is not question of them becoming old. The problem lies in their own blood and the genes. So what activates these hair loss genes? Remember, these genes are present in the stem cells of the hair follicle. These hair loss genes are switched on by epigenome, which includes basically it is your blood composition mainly. So it includes blood composition, your stress levels, the skin exposure to pollutants, basically whatever you eat, what you drink, what you breathe, what touches your skin, and the stress levels, and lastly the hormones levels. Testosterone is not the first thing which causes baldness, it is only a contributing factor. Once the hair stem cells become susceptible. So now we'll see more about this. Next slide, please. So now we come to reversing hair loss. Now here, remember, if the genes have been switched off by us, right? So we are the persons who should be able to switch them off. That is the patient or the doctor. That is called gene biohacking. We are hacking the genes. We are changing what those genes are going to make. Right now, they are making the wrong things. And we want them to make the same things that the person used to make at 15 years or 20 years of age. So just as an unhealthy epigenome activates the hair loss genes, a healthy epigenome can flip them off without pharmaceuticals. I have been doing this for past 4 years now, and most of the research which I have based this treatment on has been done by Harvard University, Yale University. So it's worth remembering and reading about those research. I'll share the links also. Now, this process of modulating gene expression, that is the future. You change the way the genes work, not change the genes. You do not edit the genes. You do not put stem cells inside. Just improve the gene expression and make those stem cells healthy. So non-pharma solutions for hair growth, they include one, optimized nutrition and lifestyle. That is a big factor which plays. If you eat burger, drink Coke, only pizza all day long, you're going to turn bald at an earlier age compared to your twin. If he is living a good lifestyle, taking anar juice, walnuts, everything good. So we go for a personalized regenerative approach in this manner. We ask the patient, what is exactly wrong? Why did you lose hair? Some of them, they are typical things, times when they lose hair, when those genes are switched off, when they go to hostel, when they go to college, when they go to Bangalore, Kota, sometimes even Delhi. Then people start losing hair a lot. Once their college finishes, they go to US. Again, you have a lot of hair loss. So what is going on? A major part you'll see in all these things is change of nutrition and lifestyle. So let's go to the next one. Next one, please. So hair loss, as you know, affects millions, and traditional treatments, minoxidil lotion, finasteride, or even injection-based PRP, they do have their side effects, and effectiveness is not very high. If it were high, then no doctor would be bald today. Minoxidil and finasteride were not recent drugs. It's more than 20 years now. So gene biohacking therapy uses natural molecules to modify gene expression for hair growth so that people can use them for long duration, even throughout their life without having side effects. So we go to the next one now. Understanding gene biohacking therapy, it involves non-pharmacological molecules. Means people get them over the counter, but they influence gene expression. This is a very important thing. And the key molecules in this are, which work on our scalp are resveratrol, fisetin, NMN, nicotinamide mononucleotide, grapeseed extract, AKG, that is alpha ketoglutarate, and rapamycin. Almost all of them help in activating hair follicle stem cells and reversing miniaturization. Let's go to the next slide, please. So let's go over the scientific basis. Fisetin and resveratrol. Remember when the stem cells in the hair follicle are in a bad environment. The environment is the blood filled with pizza and all those preservative and ultra processed food. So what happens is the telomeres start getting short. That stress, dietary or lifestyle stress causes the telomeres to become very short. Once the telomeres become very short, your DNA cannot divide, chromosomes cannot divide. When they cannot divide, the stem cells cannot divide. And that is what causes your hair miniaturization. Right? That is the primary thing. Now, fisetin and resveratrol are natural molecules. Resveratrol comes from black grapes. Fisetin comes from strawberries. And when they reach into the skin, intradermal, that is where they cause a lot of good things. One is they increase production of TERT. TERT is telomerase reverse transcriptase. Simply put, it increases the length of your telomeres again. This is something unheard of before this time. So once you re-elongate the telomeres, the stem cells become in a way young because then they can divide again. Also, when fisetin reaches into the skin, the research shows that it incites the keratinocytes, your own skin cells, to produce exosomes, which activate the hair follicle stem cells. That means you do not need to use unapproved or maybe sometimes even dangerous exosomes from external sources. Your skin can produce exosome on its own. Next is NMN and grapeseed extract. Both of them boost the NAD level. Remember, NAD means energy. A cell cannot divide. Nothing can happen without NAD. So now we have NAD precursors, something that you just give the patient and the individual cell can get a boost in their NAD levels and then they can multiply. So it helps the stem cells to multiply. AKG and rapamycin are more advanced molecules. They activate autophagy, shifting the follicles to the anagen or growth phase. So what happens overall? Within about 1 month, once we do microneedling and apply this in the way I tell, most of my patients notice a much reduced hair fall. The hair follicle also becomes strong. When they pull it, it doesn't come easily. Hair pull test becomes negative. In 3 to 4 months, the hair density also improves. So I always take picture of my patient's thinning hair in his own camera and I tell them to take it every month. Then only you can make out. And many a times, in especially younger patients, we get very dramatic results as I'll be showing you. But in almost 100% of the patients, I'll say that the hair fall reduces dramatically, premature hair fall especially. So we'll go to the next slide. So how do we do it? First, clean the scalp, wet the scalp. Always use the derma roller on a wet scalp. Comb the hair forward. Don't follow the skin technique. No crisscross, no making the union jack, no. My purpose in using a derma roller is that I want each needle to go into the skin. 1 millimeter depth derma roller. Huh? And then uh, there should be pinpoint bleeding, right? So we clean and wet the scalp and then we use the derma roller in the direction of the hair. Press it firmly so that there is pinpoint bleeding. When there is pinpoint bleeding, remember the body's repair system gets activated. The body doesn't know that you bumped your head into a wall or you just poked yourself with a derma roller. So it gets a signal that something has gone wrong. So it sends platelets and growth factors. Remember this thing. If you are using a derma roller with more than 500 needles in this full head, it will make at least 10,000 pinpoints of bleeding where the body will individually send platelets and growth factors, especially if you are leading a good lifestyle, eating good things so that you have a lot of growth factors. And this is something which the patient can carry out himself or herself at home once we train them or you train them once a week, right? Once the derma roller has been applied and then there is pinpoint bleeding, then you can apply these three serums. There is no particular order. Sometimes, like normally, I use fisetin lotion before the derma roller and resveratrol grapeseed extract after using the derma roller. It is more convenient that way. Nothing, no special reason for one before the other. And the third is freshly prepared NMN lotion. Remember, NMN or nicotinamide mononucleotide cannot be prepared in as a long-term holding solution because NMN degrades. So best is you take fresh capsules of NMN and make your own fresh lotion and also apply that in that area. Apart from that, lifestyle and supplements are required, diet corrections, stress management. Then what is needed by the hair root stem cells? The hair root stem cells also need certain food. And I must say this thing that protein, iron, those are not the main food of the stem cells of the hair follicle. Calcium is required for bone. Proteins is required for muscle. For hair, you need omega, biotin, NAC, glycine, NMN, these things. Of course, if a person is really well educated and wants to seriously get into regenerative field, then you give them senolytic activators also. Fisetin is a senolytic. What is a senolytic? It is something which kills senescent cells. Senescent cells are the prematurely aging cells in your body, which are spoiling the general environment. So once you give fisetin, it reduces or removes the senescent cells. So these are the basic steps. We'll go to the next slide, please. Now, as I said, clean and wet scalp, then use the derma roller, derma pen also you can use, derma stamp, patient can use himself. Derma pen is usually not strong enough. The motor is not that strong. So if you use it in an area which already has hair, it is very difficult to get pinpoint bleeding. And remember the previous dogma where they say that it will reduce the trauma. That is not logical. What you need is if the needle is going inside, even if it is doing a bit extra cuts, that means it is giving you that much more platelets towards that area. And the healing is excellent. If you do it correctly, there is no visible scarring. And even long term, I have not seen any problems. And why me only? This thing has been done by aesthetic physicians on faces of lady patients, vampire facial for so many years now. Just we bald men want to use it on top of our hair also, head also. So these are the things which we use. And if you need any of them, I have shown you. You can ask me or you can get them maybe online wherever. Do no need to use only my products. Okay. I'll go to the next one. Now, these are some treatment outcomes. Uh, Ignore the heading within 4 weeks. All of them are not within 4 weeks. The first picture is within a month, I can say. What we noticed, like you see in the second picture, is the hair started becoming very strong. Those hair in the temple area, which becomes miniaturized. And then the other results which you see is about 3 to 4 months after starting the therapy. And these therapies were carried out by the patient themselves at home. I did only once at initial phase to train them, then once a month, 2, 3 times. And the rest of the time they did it themselves using the derma roller every week. So it is very easy if you teach your patient correctly. And see, the results are dramatic. And even in lady patients, we use it regularly. There is no breakage of hair, no problem in that. So these are some of the results. We'll go to the next slide, please. These are some more results. So what we see is reversal of hair thinning, healthier scalp environment, and improved hair texture. Now here, remember, I have not given any finasteride, no minoxidil, and no injection PRP. Just once a week derma roller with pinpoint bleeding. Now what happens with that? Why does hair fall stop? There are three factors. One, when you are using the derma roller, there is bleeding also. So there is improved circulation, improved blood flow. That is the same thing which minoxidil does. So we do not require it. Second, when the pores are open, because you are using that derma roller of 1 millimeter, so the pores are open till the depth of the stem cells of the hair follicles. So the antioxidants, resveratrol, fisetin, they also reach the required depth. And third and most important thing, something which we were taught in school, that every time you poke a needle into the skin and there is bleeding, the body will send platelets and growth factors. So all these three things work to make this hair stronger. Apart from that, of course, the diet has to be good. Next slide, please. There are no major side effects, but we still advise that pregnant and lactating women should not use. The future in about, I know it is premature to say it, but I'm very positive that just like gene biohacking therapy now, in another 4 to 5 years, we will be having proper gene therapy, giving an injection or a vaccine against baldness. But till then, we have to save whatever hair roots are there. If the hair are there, then we can strengthen them later on. Otherwise, transplant is the only thing. Na? So next slide, please. Now, biological age. This is another thing which ties up with people losing hair at a young age. Now, many times when you have people, let's say patients 20, 21, 25 years old, and they say, my hair is falling off at an earlier age. And you tell them, okay, you are eating outside food, and they'll say, you are an old man, maybe you don't. They won't say, but they will think maybe you are too much into that conservative diet. So what you have to do, and something which should be used regularly, is get the biological age test for the patient. This serves many purposes. Biological age is the age of the body as per the blood tests. So there is a series of blood tests. Most of them are done in the routine full body checkup, which patients get done every year, barring about two, three of them, DHEA, testosterone level. Apart from them, most of them are there. Huh? So these 15 or so tests you feed into the AI algorithm, which we have made, and we share it with you. It's free for you. Just ask your patient to get those tests done. You fill in the values. Make sure that the units are correct. And then you get the body patient's biological age. Most of the time, you will see that they are 5 to 10 years older than their birthday age or chronological age. And when they follow the treatments which you are doing, the lifestyle improvement, otherwise, how will you come to know that the patient has followed your lifestyle improvement or not? You will not come to know. Na? But after, let's say, 6, 8 months, when you repeat the biological age test, at that time you will find that the biological age is reduced. So that is something which plays a dramatic role. If a patient is still having a lot of hair fall and you do biological age test and it is still the same, then you understand that something else is wrong. Either the patient is not following the guidelines or maybe we have missed something. So this biological age test not only helps you track, but also remember, imagine the patient. Once he sees his biological age is, let's say, 5 years above, then he does all the good things. Then he needs something. You can't ask a person to keep on living a healthy lifestyle forever without some objective benefits. So the biological age test, once he becomes 5 years younger, that is proof on paper. They will feel more energetic. Their skin will become better. Their hair will become better. So biological age helps guides us in long-term maintenance also. It helps us understand and modify gene biohacking strategies where they may be required. Next, please. So in conclusion, I'll say that gene biohacking therapy is a promising science-backed approach for hair regrowth. It is safer and more holistic than traditional treatments, and I'll advise you to give it a chance. You have nothing to lose. If you want to have the patient to apply minoxidil along with that, then you can do that also. Like resveratrol, the patient applies at night. He massages it in through the scalp, not only on the day when the derma roller is done, even other days. Minoxidil can be applied in morning. That way you will get a further boost. If you really want to try it, you can do that. Next slide, please. So if you need any help with products or any literature or any scientific links to these research, you can contact me also. Go to my website also. The serums, etc., are available on livenaturalproducts.com. This is my website for products. If you have any difficulty, you can let me know. And if you are a doctor, of course, we have option for bulk purchase also. I think that would be enough.
Yes,
It's the last
great.
slide. Thank you very
Yes.
much. And thank you, Dr. Miglani, for inviting me also.
My pleasure, sir. Thank you for great inputs. And knowing this, that the minoxidil can be left also by some patients, because many times patients come कि minoxidil नहीं लगाना, minoxidil नहीं
नहीं,
लगाना, और कुछ और दे दो. तो in those cases, I think it's a wonderful solution, because
yes.
मेरे पास भी बहुत सारी queries आती हैं from our doctors also. Patients तो बोलते ही हैं कि मैम any solution कि हम minoxidil नहीं दें. So I think
हाँ.
it's a wonderful drug if you have told that. So that is
Even more important than minoxidil is how finasteride.
right, right.
Remember, in my house, in my family,
Hmm.
everyone is bald. My both grandparents,
Okay,
grandfathers,
okay.
all my male relatives, elder ones. I did hair transplant for my father.
अच्छा, okay.
But I myself never used finasteride or minoxidil, even though my hair is less than what it was 30 years ago, but I have still managed to retain a lot of them. And a lot of time when I remember I do take good care, they become thicker, and I don't take good care, they become thinner.
नाइस फिनास्ट्राइड का भी सर, जैसे अगर आप प्रिस्क्राइब करते हो तो इट्स ऑलवेज बेटर कि आप पहले ही बोल दो कि इंटरनेट पे लिखा हुआ है, नहीं तो एवरी टाइम द पेशेंट विल गिव यू अ कॉल कि दिस थिंग इज रिटन ऑन द इंटरनेट एंड इट्स बेटर टू बी बायर्ड देन टू बी इम्पोर्टेंट. दैट
No,
इज
it is quite true. See, something which I'll not give to my child or to
राइट.
myself. Why will I give to a patient and say that, okay, take it, it will give you effect only 2% of the people? What
राइट.
if that person is in the 2%? I have seen patients
हम्म.
having long-term effect, not just two, three
राइट.
months, years
राइट.
sometimes. So
राइट.
that's why I avoid using this.
Yeah, great. Great, sir. And even the inputs that the people have to look for their nutrition, their environment
Yes,
change. So that is also very important.
yes, very important.
Yeah. And kids these days, they are coming in their 25, 30s also, getting almost bald. So for them, explaining all
Yes,
things, it's a boon.
yes, yes.
Yeah, great.
Children start losing hair in their school nowadays. No?
Right, right, right. We are very often seeing these patients, very
So
often.
that a major part is diet. Thank
Right.
you very much.
I truly appreciate.
Anything you want to know, you ask.
We truly appreciate your time, effort,
Thank you.
dedication, sir, in giving the time here. And any question from the audience, please let us know. I think there are some questions. Akshita, any questions are there? Yes. There are some questions, sir. Let me see. Yeah, sir, please share where to get these serums and supplements that sir has already shared. Are these available in India? What group of drugs in pharmacy? They are available in India. Sir has already given you the link.
I have given you the names also, and remember, I have not given you trade names. These are not patented molecules. I have given you the name of the molecule itself.
Right.
So that is easy.
And looking forward to see many more details in FECON, the conference which is coming up on 3rd and 4th
Sure.
May. And sir is coming to us again for giving his lecture in detail. और कुछ अगर audience को कुछ और जानना हो, देखना हो, so they can directly meet you in the FECON also.
Definitely.
Right. And Dr. Mariam is asking, does patient has to use it daily? Can you guide with the frequency?
Resveratrol grapeseed is to be used every night, and you have to massage it into the scalp. Don't leave it or don't apply it on the hair. Because
Right.
in female patients, if they apply it on the hair, it is a slight bit of stickiness. Next day it will be problem. So apply only in the skin in between, and then next day you can wipe it off.
Okay.
But every day,
How much
every night,
quantity? How much
just
quantity?
enough to cover the entire thinning area.
Okay.
It
Okay.
is usually three or maybe four, five sprays. It comes in a spray bottle.
Okay.
One bottle lasts about 1 month for a patient.
Okay. Right. Okay,
And as
doctor.
far as side effects, because someone had asked,
Mm-hmm.
before our conference, they can read up more about this. Remember,
Yes.
resveratrol and fisetin, if you take them orally, they have a different purpose. Resveratrol is very good for heart, whereas
Mm-hmm.
fisetin is a general senolytic and anti-cancer also, but when we are using them topically on the skin, and the concentration is also just 1% or less. There is no chance of any side effect, and these are normal molecules. These are natural ones. They are not drugs. I
All
think
of
that
them
is
are
the only
plant-based
difference.
products. All of them are plant-based products.
Yes,
Okay.
like fisetin is from strawberries, resveratrol is from black grapes. NMN, of course, is something which was discovered in Harvard University by Dr. David Sinclair.
Mm-hmm.
So I'll advise all of us doctors to also see videos of Dr. David Sinclair, though he'll not talk about hair. He
Mm-hmm.
talks about making you younger overall
Okay. Okay. Okay.
using these same molecules.
Right. 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 We have some more questions. Right.
I've shared the research on many platforms, and
Mm-hmm.
the only thing is that you have to, I always ask doctors, you have to read it.
Yes, that is more important. Having a good knowledge is very important.
Uh,
Otherwise, the patient is going to bombard you with the questions.
Bilkul. So I'll share the links later on. You can share with them also.
Yeah, yeah.
I've shared
Something
them before
asking, sir,
also.
for how long the results will stay, and these are also temporary or permanent?
Now tell me this thing. If how often will you brush your teeth? Until what time will you brush your teeth? What I am doing here is telling the patients to live a good, healthy lifestyle so that they have their hair at least as much as the time their grandparents had. So using a derma roller is not a big issue. Once the hair loss has stabilized,
Mm-hmm.
then you can make it less frequent also. But this concept has to be understood. Once you stop doing this, go back to the lazy lifestyle, then of course, why won't the hair fall? They'll fall again. There's no lifetime thing. This is not a disease where a medicine will cure. This is a lifestyle issue.
True, very true. And application of oils and shampoos to be avoided for how many days?
At least 24 hours, preferably 48 hours, because once you use the derma roller, pores are open. Just like good things are going inside, bad things can also go. So no color, no shampoo, no chemicals for at least 24 hours. And
Right.
avoid pollution.
Is there any contraindication in using these products? How?
Pregnancy and lactation.
Okay.
Nothing else.
Okay, great. How extensive is the research on this? As you mentioned, these are not FDA approved.
FDA will not approve Tata Salt.
True.
Why will FDA approve resveratrol? Something which is available over the counter to any person.
Hmm.
Why will FDA is not required here? FDA will be required when there is a drug. Hmm.
Right.
So these are things, I'll share the links with you. The extensive research has been done. And
Okay.
like I say, go into YouTube, just
Hmm.
write about them. You'll get
Right.
so much knowledge and so much actual research links also. It's not only that YouTube gives you only marketing. If you see some good literature and YouTubes, you'll get good ideas also.
Okay. Dr. Shobita is asking, Shobha, derma roller once a week, serums daily, right, sir?
Yes, only resveratrol grapeseed serum daily,
Right.
not fisetin. Normally, initially, I start patients on only resveratrol grapeseed serum, which is one bottle, and derma roller.
Okay. Okay.
Because giving too many serums or complicated things to them at beginning
Hmm.
confuses them.
Yeah,
One
definitely.
serum, basic serum, which is the workhorse, resveratrol grapeseed serum daily and derma roller once a week. Later on, or when the patient comes to you, you can use fisetin. Fisetin is to be applied only once a week.
Okay. Right. So there are kids who come into my salon whose scalp are visible, some temple area are going back as they are not teenage. Also, what would you suggest to them?
This is exactly what I suggest. But before that, I'll always ask you, tell them this plain thing that hair loss is not genetic. I'll not say not totally genetic, but not only genetic. Because
Hmm.
once you say it's genetic, they raise their hand that they can't do anything. Huh? Once you explain to them and they do this thing, this is the easiest thing for them, improving their lifestyle. Even the parents are happy
Right.
when you tell the
Definitely.
children, and they notice a lot of improvement also.
And many times parent only tell you, बच्चे को समझाओ ना, बच्चे को समझा देना. Yeah. So Dr.
And
Adil is
now we
asking,
have a thing
yeah,
that we can actually tell them, show him, see, your father got bald late. You are
yeah,
getting bald at 20. So what is
right.
the difference? The difference is processed, ultra processed foods.
And that point which you said that you can ask the patient to take the pictures and then compare after a gap of 1 month. So that is
Mm,
also a very nice idea
yes.
because
And
sometimes
always,
patients are hesitant. They don't give you the pictures. So we can
and
ask you
always,
to take in
yeah,
your phone only. Yeah.
and always ask the patient what he thinks he lost his hair. Why did he lose his hair? They'll come up to you with the things. They'll tell you, okay, I started losing hair when my boss was very angry with me, or
Hmm.
when I had board exams, or
Right.
when like those things will come up. They will tell themselves. So that time you can guide them easily.
Hmm. Right. So Dr. Adil is asking, all four things applied one by one in single visit, or there is a choice above four medicine?
I
What?
already told na initially only resveratrol grapeseed serum and of course omega biotin you should always give. One thing is there that PRP. I hear many times doctors saying some says PRP is good, some says it's bad. Remember, PRP is patient's blood. Who
Right.
is making the growth factors? The patient's body is making the growth factors. How will it make the growth factors? When you feed the body correct things, then it will make growth factors. None of us advise our patients to lead a good diet or health lifestyle before their PRP. If we were to do this, then of course the results will be better.
Yeah. True. Then, sir, please explain the direction of derma roller. I think, sir, in FECON, in the conference, we can keep a
Yeah,
demo
I'll do.
also for them.
Definitely.
Yeah, we can keep all the products. We can show them how it is to be applied and how the derma roller has to be used. So all that hands-on we can give them in the conference also.
Uh, uh, One last because I just saw the question. See, growth factor concentrate. Remember, just like exosomes,
Mm-hmm.
companies will come, they want to sell their products. None of them are approved. You want to take the risks? Then you take them. Because remember, tomorrow if someone comes and says that this doctor gave me this, but this is not approved, then you will not have any. That time the company is not coming to you and saying, okay, we will stand by you.
Right.
So even in GFC, you call
Hmm.
growth factor concentrate. Why do you need a growth factor concentrate when you can feed your patient to so that his body makes those growth factors? And it's not a difficult thing.
Right.
That's
Yeah. Then Dr. Anchal is asking, do we need maintenance sessions after 3 to 4 months?
if you need your hair,
Yeah, if this,
ladies go to salon or they apply products to become fair. Will they stop applying? Will they say, okay, 6 महीने में हम गोरे हो गए, now we will not apply for life? So why do you think that here is any different? No,
It's like a nutrition to the skin.
definitely.
Yeah,
And in fact, this gene biohacking therapy is equally effective for skin also. But I have not yet documented too much on that because it becomes too much information in too little
right,
thing.
right,
But
right.
as you see, many of your doctors use derma roller in this area and
Mm-hmm.
get a good resveratrol grapeseed serum. Just apply something. That is all. It's a antioxidant. Skin of black grapes. Why not?
Right.
That way.
Dr. Abrar is asking patients having an underlying dermatological or pathological disease like
Hmm.
lupus or psoriasis, etc., autoimmune disease causing alopecia, can we use these products or not, and alone
Hmm.
or along with the ongoing treatment?
I can't say yes right now because we don't have experience with this. What I can say is that it's most likely that there will be no difficulty, but we have to carefully treat this because there are some research which say use derma roller that will help even in alopecia areata, but that is not a concrete thing as yet. Once we have more experience, definitely.
Right. Dr. Manisha is asking, what are the blood tests required?
For the biological age test,
Yes, I think for
I'll
this.
uh, I'll send the link. It was there in the presentation slide also. I've listed all the tests.
Okay,
I
great.
send the link which is there on our website also, livenaturalproducts.com. There is a
Mm-hmm.
section called biological age test. You can go there and then just click it. All the tests are written there, and the algorithm is also there. You can fill them once you get the reports.
Right. Dr. Vishali asking, we can apply this to the kids? Can
How
we?
small kids? These are
Okay.
safe things, but kids not 4, 5, 6 years. Huh? We
Right.
don't want them licking them and putting in the mouth.
Right. What blood tests are included? Blood tests included. What about GFC? List of blood tests. Thanks, sir. If you can give an approximate cost for one session or the products.
See, one session, very simple, like I do, I'll take the blood also, right? Just like for PRP. And
Mm-hmm.
then we do the PRP thing, take the plasma, separate the plasma, but I do not inject it with injections. Remember, it is like drip irrigation. This is our garden. You use the derma roller, you have minute thousands of holes so that after that you apply the PRP topically and let it remain along with the serums. And it is absorbed from there. There is no point in, remember, PRP was first for knee joint, arthritis. That is why they used a needle. The hair roots are not that deep that we must give a needle. And second thing, it dissuades many patients. And third thing, how long can the patient keep on coming as a punishment to get injections put on top of his head? If he has a derma roller at hand, at in his home also, so he knows he's doing something for himself. When he's going to a doctor, he knows that something is wrong with him, he's ill, and he's going there and he's getting an injection in his head. So that psychological factor is also different. Patients stop doing PRP after some time, many a times. Whereas this is something which I have found none of my patients stopped it once they noticed even slight benefit, right?
Okay.
So I would suggest that we should encourage this.
Okay, nice. And how many hours serum should be applied after microneedling on scalp?
Leave it for about overnight.
Right. Some clients have gone through surgeries due to heavy medication or hormonal changes. They have heavy hair fall. Can it be covered with these procedures? Process?
You correct the underlying stress first, na?
Right.
Then once the body is stabilized, definitely you can start using them along with good diet and supplements.
Right.
There are
Can
more advanced things like peptides, but that I'll be able to tell during the conference.
right.
And yes, peptides are not approved right now. Hmm?
Okay. Okay.
except for copper peptide GHKCU. The other peptides like BPC 157,
Yeah.
thymosin beta 4, those are thymosin is regenerative peptide, BPC is anti-inflammatory, and they are very dramatic. In fact, some of the doctors, like in USA, they call it Wolverine peptide,
Okay.
this combination, because it helps in injury recovery very fast. But
Mm-hmm.
for the scalp, we still have to work on that.
Okay. So Dr. Khatija is asking, so this can be done in post hair transplant patients. We can do after how many months after hair transplant?
See, when I do hair transplant, I use these products throughout the procedure also. Like the grafts are stored in a diluted solution of resveratrol grapeseed. You have, let's say, 20 ml of, let's say 10 ml of liquid, you put just 1 ml of that resveratrol serum. It
Okay.
provides antioxidant effect. Once the grafts are outside the body, if given a choice, why will you not give them NAD, energy? Why will you not try to protect those stem cells by giving antioxidants like resveratrol? So I put it in the holding solution also, and we spray it while we are putting the grafts. It's not just spraying Ringer's lactate or saline. We spray diluted mixture of NMN and resveratrol grapeseed. After that, once the bandage is removed, the cuts are still there. We give the patient NMN lotion and resveratrol. So he goes back and sprays once every day, starting from the third day after the procedure. For the first 7-10 days, of course, he's gentle in the transplanted area. For the remaining area, of course, he can be thorough also. And after 1 month, he can start using derma roller on the non-transplanted thinning area and the serums everywhere. So there is no break. You don't have to wait a long time after surgery. You should start it maybe even before the surgery.
Right, sir.
Some of the patients, sorry, some of the patients, they are afraid of needles of the
Mm.
derma roller. They are not comfortable. So my advice to them is, if nothing else, then you rub that serum. The head contains holes, pores from which we get sweat comes out, oil comes out, hair comes out. So when you rub these serums also, massage them properly, some part definitely goes into the hair roots. But if the patient is really losing hair very fast and you want him to use the derma roller, you can always apply Prelox cream to numb the skin, wash off the Prelox cream after 1 hour, and then you use derma roller. So without pain, you can do.
Right. Thank you, sir. Thank you for all
Thank you
this
very much.
information. I truly appreciate and looking forward to see you in the Facial Aesthetics and Cosmetology Conference to be held on 3rd and 4th May. So we will be asking all the students to join that, to see sir, to meet sir personally and see the
Thank you very much.
demonstrations and how he talks to the patient, how he delivers his procedures. So it would be a great thing to see you in person and to
Thank
see working also.
Definitely, definitely. But remember, I'll
Hmm.
need some volunteers also. No?
There'll be a lot of volunteers. There'll be a lot of volunteers from this
I
group only.
definitely, definitely.
Right, sir.
Thank you very
Thank you.
much.
Thank you. So it was a great session by sir. So now I'll be sharing my screen. So now coming to our next topic, which is the 8-point lift in fillers. Just let me share my screen. So officially, good afternoon, everyone. Dr. Mridu Miglani here. For those who do not know me, I am a facial esthetician. I have been practicing aesthetics from the last 13 years. And I've done my aesthetics course from various places like Delhi, Mumbai, New York, Italy, Germany, many places, because when I started doing aesthetics, there were hardly any doctors who were practicing aesthetics in India. So I had to take a lot of efforts to move around the world to see how aesthetics was being performed in various countries, how the doctors in other countries were performing. And so when I visited those places, I visited some of the best practices in the world, and I saw huge potential in aesthetics. So every lecture I saw there, every procedure I witnessed there gave me more confidence in aesthetics. So back home, when I came to India and then started practicing, so soon after that, I shared my knowledge with a lot of people, with a lot of doctors, and aesthetics now is a boom. Almost every doctor, whether a dermat, whether a plastic surgeon, whether a dentist, whether a radiologist or a pediatrician, everybody is getting into aesthetics. And I think there is no harm into getting into aesthetics, because all these procedures are very small learning curve, and there is a scientific basis after that. If you are a doctor, you can easily learn these procedures and apply them into your practices. And today, after finishing this gene biohacking therapy by Sir Dr. Arvind Poswal, so we have other topics with us, like 8-point facelift with the fillers. Then we have a combination treatment in aesthetics. How do we mix and match many things in aesthetics? It's not just the botox and the filler which we can give in aesthetics. There are a lot of other things which can be combined holistically to give an aesthetic result. Then we also be covering a new concept which has come in the autologous regenerative medicine, which is known as the exomine. Then Dr. Aman Sharma will be telling you how to set up your anti-aging clinics. He has a lot of studies which show that you can treat acne without the antibiotics. He will be talking on that. So we have a good amount of learning session today. If you want to have tea in between, please go and grab a cup of tea or coffee. And I want to keep you awake. So please keep interacting with me. Whatever questions you have, you can ask me in between. Let's keep it an interactive session. I will be asking you few questions in between just to keep you awake. So everybody, I think most of us who are into aesthetics, they must be doing the fillers, Botox, thread lift, PRP. So because we are doing fillers, sometimes when we are doing the fillers, patient is going to love the result. Definitely 95% of the patients, they love the result, because in the fillers, we most commonly used thing is hyaluronic acid. So hyaluronic acid, as we have discussed many times, we all know is a molecule which absorbs water around it and gives a very good rejuvenation to the skin, very good glow to the skin, and very good subtle and immediate lift to the skin. So when the patients love the result of the filler, so they get, sometimes they want to get like an addiction to the filler. So they will come back to you, I want to get more, I want to get more. So sometimes we end up in giving the pillow faces. So we don't want to give that. So for that, we have, I will be just telling you the 8-point facelift technique with the fillers. So which is going to cover all over the face and also in a very less quantity. So 8-point lift is a non-surgical facelift technique which uses the derma fillers. We mostly use hyaluronic acid fillers. In the market, we have many other fillers, like we have collagen fillers, we have calcium hydroxyapatite fillers. So, but the most universal filler which is used is hyaluronic acid. And this is designed, the 8-point lift is designed to restore the volume, contour the face, and create a youthful appearance. That is what is wanted by every person. And this is popular for its natural looking results with minimal downtime, immediate result, and without giving you the pillow faces. So facial aging, we know, is multifactorial. So we have in our body, we have various layers of the skin. So first, we have the bones in the end. In the last thing which we have after the skin is the bone. And the aging is occurring at all levels. If we start from above, we have our skin. In the skin, we have epidermis, we have dermis, we have subcutaneous tissue. And below the skin, we have superficial fat pads, and below the superficial fat pads we have the muscular layer, And below the muscular layer, we have the deep fat pads, and below the deep fat pads, we have the periosteum and the bone. So now, as we all know that aging is occurring at all the levels in the face, we have seen in the bone, sometimes there is resorption and somewhere there is deposition. So like whenever we are aging, so there is a reduction in the maxillary bone, mandibular bone, the chin tries to elongate, the hollowness in the orbits that increases, the hollowness in this aperture also increases. So there is hollowing at some places and there is deposition in some places. That is all age related changes. Then we have the fat pads. So fat pads we have in the young face, the fat pads are in their position, like we have fat pads here, fat pads here. But as we grow maturer, the fat pads do not stay in the place where they should be. So they try to migrate. They try to come at the places where we don't want them. So at the younger age, when the fat pads are here and when we are maturing, the fat pads come down. And when they come down, they lead to broadening of your lower face, which is not wanted by, especially by the females, because the thickness which we want here, the broadness which we want here, and we want a thinness here. But those deep fat pads, they migrate slowly downwards, and there is also redistribution. So that means where we want them, they are not here. Where we do not want them, they go there. And there also the deep fat pads, they also atrophy. Then there are some retaining ligaments. So retaining ligaments are tree-like structures which start from your lower layer, which start from the periosteum. They go upwards and they go upwards into the skin and they hold the skin like the legs. If you imagine your skin like the table, so the legs of the table are like ligaments. So they are holding your skin very taut. And with age, the ligaments, they tend to weaken. And because the holding structures will weaken, so your skin elasticity, skin tightness will also be lessened. Then with age, we have the collagen in our skin decreases, elastin in our skin decreases, the hyaluronic acid in our skin decreases. So all those lead to reduced thermal thickness and reduced hydration. So we need to work on it in a totality. So this is how the orbital rim is widening, the chin is lengthening. So these are all the bony changes. Then how the concept of the eight point lift is important, because this is important, this is useful, because this gives you a structural support or the framework, rather than just simply adding. So this we add in a very symmetrical manner. Instead of overfilling, we have to proportionally add it to all over the face, and it works in synergy with our natural anatomical retaining ligaments. So as I told you, the retaining ligaments are the structures which are tree-like structures which hold the skin taut. And this 8-point lift also helps in restoring a higher cheekbone effect. Then it also decreases the jaw jowls, because jowls are one thing which when they appear, they give a lot of the aging signs. Then there is a better facial symmetry, of course, which is wanted by everyone. Then very important in aesthetics is to properly assess the patient. Just a minute. इसको minimize कर देना नीचे कर दो Okay, so we have to assess the patient. We have to see for the static lines, the dynamic lines, because we all know static lines will be improved with the help of fillers, but the dynamic lines will be will be better improved with the help of the botulinum toxin. And we have to see where the volume deficiency is more, and accordingly we can change our volume which has to be put in a particular place. And therefore it's important to consider the facial anatomy, the degree of volume loss, skin thickness, injection depth, and very important, the product characteristics. The thicker the product, deeper it will go onto the bone. The thinner the product, it will lie superficially, because if we put a thicker product in the superficial layer, it is going to form lumps. And if we give a thinner product inside or in the deeper layers, this will not give you any result. So choosing the right product is very important, because these products are expensive. Plus the patients are all result oriented. You have to give them the result with minimal side effects. So the ideal candidates for the facelift are between 30 to 65 years age, and they have little volume loss and little sagging. And they are the ones who want gradual natural enhancement of the skin. So these are the layers of the skin which we have seen: epidermis, dermis, then we have the superficial fat pads, then we have the muscular layer, then we have the static deep fat pad compartments, and then we have the bones. So can you just all write in the chat box, the muscular layer on the face is known as, what is the name given to the muscular layer on the face? So I'm just waiting for the answers. Chat. अपने में बोलो इधर. So can you just all perfect? Dr. Nikita is saying smash, smash. Dr. Pratisha is saying smash. Zoom user smash. Rishvi Pratik smash. Very nice. Shaine Mazumdar smash. Very nice. Tanvir smash. Perfect. Dr. Vishali, this is smash. Dr. Sunita smash. Perfect. Very nice. Very intelligent audience we have today. So SMAS, can anyone write what is SMAS? Can you just write the full form of the SMAS? Perfect. The answer was SMAS, that the muscular layer on the face is known as SMAS. It is covered by a superficial fascia on the top of it, deep fascia on below it. So what is that SMAS full form? What is the full form of SMAS? Can anyone write in the chat box, please? Out of, I think more than 100 people, please, anyone can write what is SMAS. Please don't disappoint me. Okay, great, good. Superficial muscular aponeurotic system, Dr. Snidna is asking, saying, subaponeurotic, no. Superficial muscular aponeurotic system, submuscular aponeurotic system, no. This is superficial muscular aponeurotic system, which means that all the muscles on the face together they form superficial muscular aponeurotic system. So this includes all the muscles, and this even starts from your platysmal muscle. So here it is known as the platysmal muscle, and here all the muscles together are known as SMAS. And when it goes back, here it becomes aponeurosis. So on the scalp also we have 5 layers. First is your skin, then is your connective tissue, then is your aponeurosis. So aponeurosis is the conversion of the SMAS of the face to the scalp. So when there are muscles on the scalp, on the face, and these are converted to aponeurosis on the scalp, and then again at the back of the neck, it becomes occipitalis muscle, and this is how a continuous sheath of the muscles is going from this area to back area. कैसे हो गया? Sorry guys, just give us a moment. There's some problem. There is some problem. Just give me a moment. Stop share कर दो एक बार दोबारा कर लेते हैं इसको. इसमें कर्सर उसमें भी नहीं आ रहा. फिर guys, there's some problem, some technical problem that we are not able to move the cursor. It is there. तुम देखो, मैं इनको कैसे बता देती हूँ उस पे. मैम वीडियो ऐसे रहेगी. हमारी ऐसे रहेगी, ये उसका वीडियो. हमारे वाला लॉगिन दिखा दो ना मुझे, उससे देख लेते हैं. पीपीटी इसमें पीपीटी हम चेंज कर लेंगे ना. पीपीटी दोबारा हम लॉगिन कर लेंगे. यू जस्ट स्विच ऑन योर वीडियो ना, सो आई विल शेयर फ्रॉम देयर. आई कांट शेयर फ्रॉम वीडियो, स्विच ऑन वीडियो. I will speak from your ID. I will just go extempore without the screen. आप इसमें check कर लो तो. Till the time that
It's on
Akshita is
mute.
saying that.
It's on mute. No, this is not.
Guys, can you hear me?
No, if they'll be able to hear you, I guess. आप इससे वीडियो बोलो and the audio is coming from here. जब तक I'll check.
Okay. So till the time we have the screen share being corrected, so I can just go extempore and show you. Are you able to see this? Are you able to see this? So I'll be telling you all the 8 points which we have to cover. So 8 point basically means we have to target on the face the 8 points. So 8 points we are starting from the first from the cheek. So we will always the mid face is always the base of your fillers, because whenever we want to do the fillers we have to start, we obviously want to give a good foundation, and the foundation of the face is from the cheekbone. So this is the zygomatic arch. This is the zygomatic arch. This is the zygomatic eminence. And here, where is the zygomatic arch starting? So that is your point for the cheek injections. So that is your first point for the injections. So this classification, the 8 point classification has been given by a doctor called Dr. Mayo from Brazil. So he has given all this 8 point classification, so wherein you have to give 8 injections at different points to give the full facelift. So our first point is this area where the cheekbone is just starting, where the zygomatic bone is there. So where this starting, we mark this point on the patient's face. So we are marking it just a simple line, a straight line we can draw, and where this is starting, we can just mark 3 symmetrical points at a gap of 1 centimeter, you can say, like this. Can you all see? So if this is my zygomatic bone, so I will give my first points at this
Not
area.
visible. It's not visible.
Is it visible?
No, it's visible. Now it will be 1 second. Just a moment.
Okay, give us a minute. We are working on it. Give us a minute.
It's working.
Okay, this is working, I think now. Is it visible? मेरी screen देखो ना मुझे.
The cursor is not visible. That's what I'm saying, no?
Can you hear also? If you can see the slides, can you hear also? It's visible on that screen.
Just a moment. No, it's not.
So can you all see and can you all see the slides also? I'm so sorry, there was some technical glitch.
You can see the slide here. Same change. ये तो पानी की from here you started, right? So you can see the slide here and the visibility is there.
Okay. see there and talk there. Look London and talk.
Don't do anything.
Look London and talk Tokyo. So I have two systems. I am seeing there. I am showing my face here and I have to study read from that laptop. Okay, so is it comfortable? Okay, it's perfect now. Okay. So the concept of the 8-point filler we have seen, it gives a better facial symmetry. This gives this restores a higher cheekbone effect, decreases the jaw jowls, decreases the sagging skin. Very challenging. So these are the layers which we were talking. First, if we start from below, this is bone. Better to start from above. Above is epidermis, dermis. Then we have the dynamic superficial fat compartments. Then we have the muscular layer. All of you answered it well, SMAS. And then we have the static deep fat pad compartments and then the bone. So the superficial fat pads are important. They are a very important layer on our face. And there are four important superficial fat pads. One is the infraorbital compartment, which is just below the orbital rim, which is near the orbital rim. Then we have a medial cheek fat compartment below the infraorbital fat compartment. Then we have a nasolabial fat compartment, and then we have a medial cheek fat compartment on the middle cheek fat pad compartment on the lateral side. So first is nasolabial, then we have the medial, and then we have middle, and then we have the infraorbital. So these are the four superficial fat compartments which are little mobile. Then we have the deep fat compartments. So deep fat compartments are the compartments which are more static. So they do not move much. But when we are injecting fillers, so we have to give a support to the deep fat compartments because they are static. They give the contour to your faces. So we need to go deeper with our needles to put into the deep fat compartments. And always it is best to work on both the things. Along with the deep fat compartments, we need to work on the superficial fat compartments also. And in the deep fat compartments, very time they so in the deep fat compartments, we give a harder filler, like you can give Voluma, or you can give any filler which has a thicker consistency. And in the superficial layers, we give a thinner filler, which is very softer and which can be gelled with the superficial fat compartments, and it should not form nodules in your superficial layers. So while the deep fat pads are relatively immobile due to their depth and attachment to the bone, the superficial fat pads are dynamic and they will move with the face animation, such as with the smiling. And these are the ligaments which I showed you. They arise from the periosteum, attached to the dermis. There are some false ligaments also, which attach from the dermis to the underlying SMAS. And this is the 8-point lift which we were talking. The first points are the cheekbones point. So you have to mark a line on the zygomatic arch. You have to mark 2 points, 3 points here. This is CK1 area, also known as L1 area. So here you can give 0.1, 0.1, 0.1. So if you see a syringe of any filler, so you will be seeing that usually the syringes come in 1 ml. So when we mark 3 points, so at each point we have to give 0.1, 0.1 and 0.1. So at this point, which is our L1 point for the cheek lift, so there you have to deposit 0.3 ml. So that means when we are giving it at 3 points, 0.1, 0.1, 0.1. So L1 is divided into 3 points. So instead of giving one complete bolus of 0.3 ml, we are going to give 0.1, 0.1, 0.1. And then our next point is the L2 point, that is the point which is directly below your orbital rim. So if you touch your orbital rim, and you draw a perpendicular line to your zygomatic arch, so this will give you a point which is known as the L2 point, and this also is a point when you fill it, this immediately gives a wow effect to the patients because this is going to lift the whole face. So when we give on the L2 point, we have to go directly deep onto the bone. So when we take our needle, we go at 90° and we go and hit the bone, and we do not inject unless and until we feel the bone. And once we have felt the bone, then we aspirate it for at least 10 seconds because vascular occlusion has to be avoided in all cases. And no place, no area on the face is a no risk zone. Every a point on the face is a risky zone that we must know in our minds. So aspiration at all points for minimum 10 seconds is very important. And the danger points where there are more chances of vascular occlusion, there you should aspirate for at least 20 seconds. And then after L1, L2, we have another point which is known as L3. So this is a point, if you draw a line, diagonal line from the outer canthus of your eye to the mouth. So when you draw this line, this point will lie on that area. Is it visible? So if you draw a line from the outer canthus of eye to the outer lip corner, and you draw a point at a junction of upper one third and lower two third, so this is the point of your tear trough or the anteromedial cheek. So this is the L3 point which needs to be filled up for complete lifting of the face and improvement of the tear trough also. This point can be given with the help of cannula also, and from the with the cannula this has to go subcutaneously. And then there is a point L4. So L4 is a point which is at the piriform fossa. So the piriform fossa is the point where the canine root is lying. So if you will go and hit that area, you are going to in the close proximity of your canine root. But this L3 and L4, they are marked in red and they are little dangerous areas because L3 is very near to one point. Can you just write in the chat box, why is L3 point a risky zone? Can you just mention in the chat box, why is L3 a risky point? You want to see L3, it's written in the chat box. This is the point. Very nice. Infraorbital foramen. Dr. Nutan, great. Infraorbital foramen. So, right, then somebody is writing nasolabial artery, no. Facial artery, no. Infraorbital foramen, right. Risk of blindness. Facial artery anastomosis, infraorbital nerve and blood vessels, perfect. Infraorbital foramen, perfect. So, L3 is a point which is very close to your infraorbital foramen. So, infraorbital foramen is a foramen which is lying below your inferior orbital rim. This is your inferior orbital rim. So inferior orbital rim से आपका 4 to 5 mm below is your infraorbital foramen. This is your infraorbital foramen. This is the area where your infraorbital nerves and blood vessels are coming out. So this area is a very dangerous area. So whenever you are treating this area, try to aspirate at least for 20 seconds. And if you do not want to take a risk, you can even switch over to cannula. Cannula is a safer, much safer. It reduces the risk of vascular occlusion by almost 77%. So there is a technique again for using the cannula that we have to go and make a puncture with the help of a needle, and then we enter with the help of cannula. So cannula is much safer than a needle. So to target the this area, so this area is a danger zone because this NL, this area which is also known as NL1. So this is a risky zone. So now tell me in the chat box why this area is risky. What is the danger? Why this is a danger zone? Why the NL1, which is the canine fossa area or the piriform aperture area, is a danger zone? Just write in the chat box why this is a danger zone. We are just keeping it as a very interactive session. Please don't hesitate. Size of the cannula can be 25 gauge, 23 gauge, whatever you are comfortable at. 23 or 25 is good enough. And if you use very thin cannula like 26, then there are chances of vascular entering into vessels also. So you can use 23 or 25. Yes, perfect. Dr. Pratisha is asking, saying facial artery, perfect. Triangle of death. Facial artery, Dr. Richa Didri, perfect. Tortuous course of facial artery, angular artery. Angular artery is little above. The facial artery is ending as angular artery at the bridge of, at where your nose is starting. So the angular artery is here, but here is your facial artery. Perfect. Very good answers. So nasolabial area, you have to read it very carefully. If you do not want to inject with the needle, again, you can go with the help of the cannula. So you can start injecting the nasolabial fold from a point which should be little medial to your nasolabial fold. It is never injected lateral to the nasolabial fold, because the moment you go lateral to the nasolabial fold, you are going to give a fullness in this area and you are going to worsen the nasolabial fold. So always try to inject medial to the nasolabial fold, and with the cannula when you enter, you can leave a deposit here, and then with the linear thread you can come back. Then our fifth point in the 8-point lift is the marionette lines. So marionette lines is a point which is running from the corner of the mouth downwards. And anyone knows what is the meaning of the marionette? What is the exact meaning of marionette? Can you please write in the chat box what is the meaning of marionette? Very nice, Dr. Sophia. I'm so happy you answered this. Very nice. The marionette means it's the moving puppet. It's a puppet which has moving parts. So a moving puppet also has these marionette lines. So the puppets usually have this line, this area, which is separated from the rest of the face. Because when the players who are working on the puppets, so when they move the parts, they move this part as whole again from the this as separate part. So these are the marionette lines. So marionette lines make us look sad, also make us look aged. And this is because of the depressor anguli oris muscle. So we have to, when we are doing the buttocks, if it is a dynamic line, so then we work on the depressor anguli oris muscle. But if it has become static, so then we fill it with the filler. So with the filler, you can either give it a fan shape appearance. You can start your point from here and you can enter like this in the form of fan shape, or you can just give boluses also. And in the bolus, it is a serial puncture technique. But when you are giving it in a fan shape manner, so this is a fan shape technique which goes and fills up your marionettes. Then we have the pre-jowl area, which is just below the marionette line. So there's a depression on the jawline, which is also known as the pre-jowl sulcus. So here you can go and hit the bone again with the help of the needle. Again, aspirate it for around 20 to 20 seconds. And then you can give a bolus here in the pre-jowl sulcus, which is going to improve your jawline contour. And then we have the angle, which will define and sculpt your face. And then we have the submalar area. So submalar area is not injected in all the faces. It's only injected in those faces where people feel that they have a deficiency or hollowness in this area, which is the submalar area. Like some patients will feel like this. So they do not want to have these hollowness. So they want to get this hollowness filled up. So again, this hollowness can be filled with the help of the cannula in a fan shape manner. So this again is a very quite safe zone if you go with the help of the cannula. So this is the 8 points which we have seen. First is the L1 point, L2 point on the zygomatic bone. L1 is your zygomatic bone, L2 is your zygomatic eminence. Then L3 is a point which is on the line joining the outer canthus of the eye to the nose, and this is upper 1/3 2/3 ke junction pe. This is your L3. Then we have L4. L4 is a danger zone which has to be injected very carefully on the piriform fossa. Then L5 is your corner of your mouth, that is a marionette line. Then L6 is your pre-jowl sulcus, which is going to improve the jawline. Then your angle, which will define and sculpt the face. And then we have the submalar hollowness, which is to be injected only in those spaces who want to improve the fullness, who want to improve the hollowness in this area, and they want to have more fuller faces. How much ml? I'm seeing the chat box and they are written. Somebody's asking how much ml at each point. So I've told you L1 pe we inject 0.3 ml at 3 points. Then L2 pe we inject around 0.2 ml. L3 pe you can inject 0.2. L4 pe you can inject 0.3. Then we have L5 you can inject 0.2. L6 you can inject 0.2 or 0.3 depending on the hollowness, and L7 you can inject 0.3. So if you count in total, it will be around 2 ml total on one side. So 2 ml one side and 2 ml on this side is going to give the complete facelift on any patient without asking them to go for 6 ml, 7 ml. Some people go for 10 ml also, 12 ml also. So without giving that, we can just go for the 4 ml usage and in that too divided at 8 points on each side of the face. So these are the 8 points which we have already discussed. So we have a lot of topics still to be left to be covered, and we are short of time. And this is how it is injected on the zygomatic bone. So we have to go and feel the bone. We go at 90 degrees, we go and feel the bone. Unless and until the bone is felt, we do not inject. We aspirate for at least 10 seconds, and then we have to inject very, very slowly. Do not be fast in giving injections. It has to be a very slow injection. Taking out the needle, taking in the needle has to be done very slowly. And try not to give any bruise, because as there is a clinician called Arthur Swift, he always says, once you bruise, you lose the patient. So it should be very, very gently done. There should not be any bruising. There should not be any other side effects which can occur. So go very gently, come out very gently. And wherever there is, we have to inject on the bone, we have to give with the needle. We have to go and hit the bone with the help of the needle. We have to feel the bone. Again, a problem. And wherever there is a softer tissue, there we can go with the cannula with the help of fan shape technique, also known as the linear threading. In the fan shape, we can use the linear threads. It can be a retrograde anterior threading, or it can be an anterograde linear threading. Then we can also use the fanning technique, wherein we have one entry point and we go like a fan to fill up the complete area. Like if we have to do the marionette line, we will enter from here and we go like this. We come back, but we do not come back completely. We again change our direction. So like this, we change our direction and we fill it up in the form of a fan. So injecting small boluses of product into the deep fat compartments with the needle, they will create pillars to support the superficial mid-cheek structures. So whenever we are injecting on the bone, it has to be in a pillar kind of form, because that pillar is going to give you the support for the superficial mid-cheek structures. So if this kind of the patient comes to us who has a deep tear trough and a malar mound, so we will not fill up into the malar mound, because if we give the third point, which was the L3 point, which was at the junction of upper one third and lower third on the line joining the outer canthus of eye to the lip. So there here you're not going to fill up the malar mound, because this is going to give much more swelling in that area. So we have to shift our point little downwards so as to camouflage the tear trough area also and to give it a beautiful effect. And whenever we have a choice between the needle and the cannula, so whenever we are doing on the bone, we prefer to use a needle. Whenever we are doing the subcutaneous tissue, we prefer to do it with the cannula. Then maintenance session can be done with the help of skin boosters like the Skin Y, Vital, Vitin, PDRNs. There are a lot of things which have come up in the market. There are biostimulators like Profilo. They can be done. They can be given to the patient for the maintenance, for the optimal skin health. And the benefits of the 8-point lift is that it provides a natural youthful appearance, non-invasive with minimal recovery time, improves the facial symmetry and contour, immediate results lasting for 12 to 18 months. And safety considerations, you have to have the very best of the anatomical knowledge. You should know what are the danger points, where is the infraorbital foramen, where is the supraorbital artery, where is the angular artery. So vascular occlusion has to be carefully detected. It might express in the form of blanching. It might express in the form of acute pain by the patient. It might express in the form of purplish discoloration. Very thin veins will be visible. Purplish veins will be visible. That is also known as the livido reticularis. And always make it a rule, whenever you are injecting fillers, you always need to have hyaluronidase in your clinic. Without hyaluronidase, please do not inject fillers. You never know, an emergency can come. So they can be delayed onset nodules. You have to manage them with the help of steroids or the antibiotics. Bruising and swelling has to be avoided with the proper pre and the post care recommendations. And it has to be done in the proper sterile environment, proper sterile gloves. Everything should be sterile when you are doing the fillers, because sometimes we have even seen bad cases of infection in the filler cases, because filler is a sugar which attracts the germs like anything. And if you recently had some vaccine, or recently had some root canal treatment, or recently had some bacterial infection, so always give a gap of at least 1 to 2 weeks, so that the sugar which you are putting inside the faces should not attract the germs which have been there because of some infection. And contraindications, any active skin infections, it should be avoided. If there is a risk, if there is a history of herpes, you can always give an you can always give acyclovir to the patient. If there is autoimmune disorder, that is a relative contraindication. You have to deal it carefully. Uncontrolled diabetes, coagulation disorders should be avoided. History of severe allergic reactions to dermal fillers should be avoided. So the 8-point lift is the gold standard because it targets the facial aging at multiple levels. It provides natural, long-lasting results, uses hyaluronic acid, which is a very safe molecule and is reversible. That is the best part about the hyaluronic acid. And the future trends are, we are going to soon have, rather we already have, the artificial intelligence driven facial analysis for personalized filler mapping and advanced hybrid fillers with collagen stimulators. And then we have an important announcement coming up, that all of us who are present here, I am inviting you, I'm glad to invite you for our conference, which is the Facial Aesthetics and Cosmetology Conference. And before I announce that, I would like to take up any questions if you have. Please let me know what are the questions. How much ml, Dr. Okay, we have done. Cost of the 8-point facelift for 4 ml. So cost of the 8-point facelift for the 4 ml, I would say whatever quality of the, whatever type of the filler you are using. So I would say at least double the amount of the filler which you are using. So that should be a reasonable thing for you to charge from the patient. So whatever type of fillers you are using, at least double the amount of the filler what we are using, because it's not the one thing which you are investing. It is the whole clinic setup. It is the amount of thing you have, amount of money you have invested in your studies, amount of time you have invested in your studies. So that is going to give you an answer what you have to charge from the patient. Then Restylane brand filler you prefer? Yes, Restylane again is a good brand. It has various subtypes in it. There are Restylane, there is Restylane Kais, there is Restylane Define, there is Restylane Voline. So all of these products can be used mix and match. The thicker the product, it has to be used on the bone. The thinner the product, it has to be used subcutaneously. Then please repeat the quantity per unit injected. Okay. So L1, we have to inject 0.3. You can note down in your notebooks if you want. So L1 is to be injected at 3 points. This is 0.3 ml. Then we have L2, which is just below the orbital rim on the zygomatic bone. There we have to inject 0.2 ml. So 0.5 will be covered in L1 and L2. Then we have L3, which is on a line, diagonal line. So there you can inject 0.2, but it has to be done very carefully. Then we have point L4. So L4 pe, or the nasolabial point pe, you can inject 0.3. So 0.3, 0.2, 0.2, 0.3. So this gives you one syringe. Then you can inject at the marionite line 0.2, and at the this area you can give 0.3 pre-joggle circus. So 0.2, 0.3, and then in the submalar area you can inject 0.5. So complete 2 ml syringe on one side. So next question is, what are the pre and the post care instructions? Pre instructions are that ask the patient not to take alcohol on that day, not to take any blood thinning drugs on that day, and not to have tea or coffee just before the procedure, because all these are the blood thinning drugs, so which can lead to a lot of oozing. And the post care is that ask the patient not to do any vigorous exercise for at least 3 to 4 days, because wherever you have placed the filler should stay there. It should not migrate to the other places. And then ask the patient not to touch the face for at least 12 hours, because when you are injecting at any point, the pores will the holes will remain open for around 12 hours. So ask the patient not to apply any makeup, or not to apply any foundation, any foreign thing for at least 12 hours. And then not to massage on the face, not to get any other treatment like peels or like any other treatment like lasers for some time. Lasers have to be avoided for at least 2 to 4 weeks, and no other treatment like microdermabrasion or any peels for at least a week. So these are the post-care instructions. Then any good brand of fillers for lips, there are a lot of good brands. You can use Volift, you can use Restylane Ka Kais. Then we have another EPTQ filler which you can use, 300 or 100 can be used for the lips.
This-
Okay, cost is done, good brand of fillers is done. Please, any questions, let us know, and then we can invite our next speaker. Can you call Dr. Aman Sharma and just ask him if he's ready with this? So we have another speaker, and before I invite my next speaker, I would invite everybody here present for the FECON registration. So we have the 12 CD points being given by the Dental Council, and this is a summit going to be a very beautiful summit for aestheticians, for the dental professionals, for the dermas, for the innovators, for the researchers, whoever wants to excel their knowledge in aesthetics. So this program, 2 days program is going to be held on 3rd and 4th May in Delhi at Radisson Blu, Paschim Vihar. So we have all the good number of speakers who are going to be there from all over the country. Like we have many speakers, three speakers who are coming from Mumbai. One speaker is coming from Europe, especially for the conference to share their knowledge. So you're all welcome to the FECON conference, that is the Facial Aesthetics and Cosmetology Conference. And there are going to be huge scientific sessions. There are going to be good hands-on experiences, good live demonstrations, and you will also get a chance to represent any of the case presentations if you have. You can all present your cases there, and there also be prizes for the best scientific paper presentation, best scientific poster presentations, and there's already a prize fixed for the first 5 early bird registrations, and we have already got 50 registrations done, and for the next 49 registrations, this prize which we are giving you is 7,000, and the link to register for the FECON is there already in the chat box. So whoever is interested, because 50 people have already registered for this prize, and this prize left is only for next 25 spots which are left. So anybody interested can use this link and do the registrations right now, and it's going to be a huge fun learning experience. You are going to make a lot of new friends. You're going to meet a lot of best speakers of the country, best speakers of the world, and you're going to have a good live demonstrations, good hands-on experiences. So whoever is interested, please log into the link given in the chat box. You can just register right now, and because only this price is available only for 25 spots now. And then I think I should stop sharing. Multiple presentations. I know. Next speaker of the day is Dr. Aman Sharma. So Dr. Aman Sharma is a clinician, educator, and a speaker with deep expertise in integrative dermatology, aesthetic medicine, and functional root cause-based care. So with a passion for treating chronic acne and aging from within, Dr. Sharma blends science and traditional systems to deliver the results that go beyond the superficial. He does not believe in just giving the superficial treatments. He believes in giving the holistic approach to the clients. How do you treat your patients holistically? That is very important. As we had the earlier speaker also with us, Dr. Arvind Koswal, he was also giving a stress upon treating the patients in totality. कि होलिस्टिकली आपने पेशेंट को कैसे ट्रीट करना है, उसका न्यूट्रिशन कैसा होना चाहिए, उसका स्लीप पैटर्न कैसा होना चाहिए, उसकी डाइट कैसी होनी चाहिए. सो दैट इज वेरी इंपॉर्टेंट. इंस्टेड ऑफ जस्ट ट्रीटिंग द outside the skin, we should treat inside the skin also. So Dr. Aman Sharma is specialized in that also. He is known for his system based thinking, clean aesthetics, and real world implementable strategies for clinic success. We are very lucky to have you here, Dr. Aman Sharma. You're most welcome. And he has completed his 3 years of training in DNB, following which he completed Masters in Clinical Dermatology from Skin Institute, Delhi. He has also done certificate course in naturopathy and yoga, and he also did a training of yoga from Delhi. And we welcome you to today's online program, and looking forward to have great insights from you, Dr. Aman. So over to you, Dr. Aman. Thank you for coming.
Thank you, Dr. Mridu, for inviting me today.
Pleasure, sir.
I would like to keep the session very, very interactive, and whatever questions, whatever interventions, whatever comments come to mind, I'd request the doctors to please keep messaging it on the chat box, because that is the only fuel for the presentation. Otherwise, we all get bored and tired of one-way conversations. So I have the chat box open with me, and I think I can see I'm typing a comment there. I think we can see, everybody can see my comments also there. So this is about acne and scar clinic. I would like to present a different approach to seeing and setting up and the challenges that come to us when we set up a acne and scar clinic, when we set up something for anti-aging and longevity, when we are setting up, when we are integrating, wanting to start a particular service or wanting to treat a particular indication. It can be pigmentation, it can be some dermatological conditions, it can be dullness of skin, it can be acanthosis or insulin resistance. They go hand in hand. So what is it that the core problems that we face and how we can tackle them is what I want to share about today. So before we go ahead, I would want to ask the doctors present here that what are our real problems? What is the problem that you are encountering in your clinic today with respect to treating acne and managing scars? I'm open to seeing comments. Doctors can share their comment. Just say whatever comes to your mind, whatever you feel is the challenge in treating, whatever you see is the challenge in treating this sort of conditions. Yeah, recurrent acne. Great. Thank you for breaking the ice. Acne with pigmentation and scars. Exactly. Any other problems that come to mind when you are treating? When you're treating acne. Acne is pigmentation, melasma, PIH. Fantastic. So these are all problems, these are all concerns. So now what you yourself are commenting here is the clinical condition. You're commenting melasma. Now, managing melasma and acquiring skills to treat melasma intervention are two different things. Now, listen to me carefully. How much of a problem is it for a doctor to get the skills that you are striving to get? Now, you are wanting to learn PRP the right way. You are wanting to learn microneedling, fillers, such a great comprehensive, and you've got great trainers like Dr. Mridu, which will make fillers seem easy. With her experience and with her training, and I was attending the presentation, she summed up whatever we've learned in 20 years of injecting in a short presentation. That's amazing. So do you really feel that as a doctor, these skills are difficult for you to master? Do you really feel that these skills are difficult to master for you? Great. So these skills are not very difficult to master. Exactly. Absolutely. So that is one very clear consensus I want to drive to you, that these skills, be it a laser, be it laser hair removal, be it these are all very simple aesthetic treatments. Even the skill-based treatments, fillers, Botox, threads, with great trainers like Dr. Mridu and whatever you will come across, many more also. These skills you will master as you do. Then where is the problem? Passion for aesthetics absolutely is an absolute need. When a passion for any profession, we need to be all very passionate about whatever we are doing. Otherwise, in any profession, the results are not that great. So how do you differentiate from so many clinics all around? Now you can see all around you, there are dermatologists, there are people from other specialities in medicine, MBBS. There are non-MBBS doctors doing it. There are BDS doctors doing it. There are BAMS and BHMS also coming into the foray. Whole bunch of different specialities, different pathies are coming and amalgamating themselves in the field of aesthetics. Then how can we differentiate ourselves is my key question. How can you make sure that your clinic is different from what others are offering? I want you to think about that. That is where my whole ideology and whole philosophy comes into the picture, because ultimately you will learn the skill. It is difficult to give consistent results. Sometimes is a problem. Some patients would respond, some patients would not respond. Holistic and all-round approach, improving skill and learning, mastering on injectables. Of course, as you keep doing injectables, you will keep mastering on injectables, absolutely. The real skills, the basic skills are there. You need to learn everything about all the interventions, all the procedures, all the skill-based procedures, Botox, fillers, and threading. You need to learn the skill aspect of it. Of course, you need to learn the technique aspect of it. For lasers, you need to energy-based devices, you need to learn the technology aspect of it. But delivering results and delivering results consistently is one important skill. Second important skill is complete, clear, transparent communication with the patient. I never promise a patient that you would get some sort of a result in 1 ml of filler. Mostly I tell them, okay, we'll do a little bit. You'll see you just experience it for 1 ml, but you cannot see great results with 1 ml, 2 ml fillers. Every day you will come across a new technology. How do you differentiate a new technique of doing something? How do you differentiate a new technology from a useless technology? How do you differentiate a new injectable or a new IV drug from evidence-based? Everybody's doing exosomes, but show me the evidence. Where is the evidence? There is hardly any publication on exosomes, any good quality publication for exosomes on skin. So we are immediately pouncing upon non-evidence-based therapies. That is the third skill. And these are also problems that we face. Sometimes for certain indications, we don't have clear standard protocols in our clinics. Many doctors whom I meet and I train and I interact with, we don't even have a standard protocol for certain indications while doing PRP, while doing peels. So we need to have standard protocols. For example, my staff, everybody is trained in recognizing herpes of the lip. In my absence, if there is somebody which comes for a facial or a hydrofacial or a medifacial or any laser treatment, the technicians are trained to recognize herpes and seborrheic dermatitis and are refused to start the treatment without a doctor consult. So these kind of standardized protocols is another skill that we need to learn. Managing footfalls, local marketing, and PR activities is another problem that we face, and that is another skill that we need to understand. Okay. So we need to learn to differentiate, and what can differentiate is what I will try and talk about. How can we differentiate? Combination of treatments with different pathies. Dr. Devyani, I didn't get that. Yeah, root cause approach, top-notch skills, communication with the patient. Absolutely. So how are we going to develop this and make it standardized. A lot of you have mentioned great points there. Now the challenge is, whatever we are trying to treat, whether it is acne, whether it is anti-aging, whether it is pigmentation, whether it is scars, what does the patient want versus what the patient really needs? What is the patient expecting out of it? The patient comes to us for a problem, for a concern, say dullness of skin, pigmentation, acne scarring, facial aesthetics, contouring. For example, you get a chubby face. You may contour it to the best of your ability. You may use energy-based devices. You may use Morpheus. You may use other MNRFs. You may use HIFU. You may use Ultracell Q+. You may use anything. You may do a good job with the threads, but the chubbiness of the face, how is it linked to the metabolic aspect, to the gut health of the patient, and to the bloated feeling that the patient has? How does it transmit to the face, and what can be done in a standardized manner for that problem is what will differentiate us from the rest of what everybody else is doing. Patient, for example, comes to you for acne. What they want is cure for acne. Are we really treating acne and aiming to cure acne with whatever we are doing? Or we are just symptomatically treating acne? I would ask this question again, and I would expect some responses now. When the patient comes to you for something as simple as acne or dullness of skin, we are providing them with services. We are providing them with skilled services, consistent services. But the patient in his head or her head is wanting a cure. Now, what can cure acne? How many of us are trying to cure acne? Yes, Harinder. So are we trying to cure acne with the gut health, and how are we trying to do that? Lifestyle changes. Exactly. So my entire focus is on creating a standardized protocol, a standardized approach, a simple approach, a reproducible approach to integrate whatever externally and internally we can do in modern medicine, in evidence-based medicine, with the curative approach for acne. Exactly. So we can detox the body. I am glad to see that people are talking about it. Otherwise, most of the time we end up only discussing what isotretinoin, what dose, what cumulative dose, what antibiotic, what and not antibiotic, what is the spectrum of this antibiotic, what probiotic to give, what external application to give, which product is good for acne, which product is good for acne scars, where to reduce redness. Are we tackling inflammation in acne? Acne is an inflammatory condition. We are tackling only how much of your effort. I would just want you to answer on the chat box or think for yourself. How much of your effort is actually going in to correcting the imbalance in omega-3 and 6 fatty acids in the body? And can you measure it? If we are creating a balance in omega-3 and 6 ratios, we are targeting inflammation, we are targeting hormonal imbalances, we are targeting metabolic imbalances at a much deeper level. How many of us really do that for acne? How many of us are really putting in effort to have a curative approach for acne? So this is where the difference lies. What we want, what the patient is wanting or expecting in his head, what he is getting in return is only services and skill. If you do a simple chat GPT or a Google search on cure for acne, it will answer for you that none of the top medicines that we use for acne is curative. Unfortunately, the relapse rates are very, very high. So this is my only deliverance on how to change the approach to an integrated approach, how to integrate aesthetics and create a value system for the patients, whereby they get what they need. And it is our responsibility, it is our job, it is our skill to communicate to them. If you learn about something new, for example, exosomes, you can convince your patient about exosomes. You learn about something, something which is not even evidence based, and you can convince your patients to get that procedure done, or to get that facial done, or to get that laser done, or to get that thread done. And you have a great power as a physician with you to convince your patients. Now, if we are convinced about how to manage the root cause with a simple 5-point agenda, then you can really deliver it to your patients with conviction and give them a clear understanding what can cure them and what will make a difference between great results and mediocre results. Okay. I agree, Dr. Harinder, that pitta nature of the body. So we need to explain that, and we need to be very clear in our communication that this is what we are dealing with, and we do it scientifically in a reproducible manner and in a scalable manner, in which the modern medicine also, evidence-based medicine also agrees with that. And we need to create that data, and we need to publish that data also. Same applies when a patient comes to us for aging related changes. You may see aging changes of aging in sagging, in skin color, in tone, in fine lines, in wrinkling, in dynamic wrinkles, in static wrinkles. But what are the real causes of aging? The real causes of aging are mitochondrial decline, inflammation, glycation. These are top changes: hormonal decline, fat muscle ratio, your circadian rhythm disruption, gut dysbiosis, environmental damages, of course. And it all results in telomere shortening. And telomere shortening is a gold standard currently to understand the depth of aging related changes. Now, what can we do to actually reverse aging along with whatever you are doing, along with your skill that you have built, what you have learned? You can actually add on the integrated approach to reversing aging, to halting aging, and in a documentable way. So that technology and that those tests are now here. Again, the same question for aging: what we want, what we need, what the patients need, and what we are giving them. Now, if we are giving them this approach in a more detailed manner, just like we are investing our time in learning a skill, in learning injections, in learning lasers, in learning technology, if we are able to give them an integrated and holistic approach, then we get their loyalty for sure. So that is what will really differentiate us from the whole bunch of people that are practicing around you. So the approach is integrative and functional. We are not promising magical cures, but we are attempting them. We are at least changing the way we look at health and disease. We are changing the way that you look at symptoms that the patient comes to them, and educate them about the integrated and functional approaches, and talk and educate about curing. Absolutely, Dr. Jagmeet, naturopathy, functional medicine plays, and that is exactly what I am trying to deliver here. So, and even not much time is needed. Only what is needed is the conviction of the physician. If the physician is convinced that statin will provide definitive benefits to my patient, he will convince the patient for statin. And if you are convinced that the curative approach, evidence-based interventions, and the functional approach can help my patients, if you are convinced that what my 5-point agenda, the 5-pillar approach, if that can help your patients, if you are convinced, you will convince your patients, and patients will not have an option to say no or to think otherwise. No, give me isotretinoin. How long can they have OCPs and isotretinoin? How long and how much IV can they take for anti-aging? So the concept of medicine is the P4I medicine. This is predictive, preventive, personalized, and participatory approach. This is the integrated approach of management. The 5-point agenda involves What I tell my patients in the functional approach, this involves a customized plan of feasting, eating right, fasting, strength training or hormetic stress, sleep or mental rest, mind stress patterns, mind stress food patterns, and fifth is the bio individualized customized supplementation. So this is what we do for almost every indication, for almost every concern, and we integrate it in a protocol whereby you get a hang of the treating that particular condition holistically rather than investing entire energy in learning how much isotretinoin to give, for how long to give, what antibiotic to give. The entire energy goes there. What point to do face to, you will learn that. That is not a very difficult part. With great trainers, it is not difficult. Somebody is willing to teach you these kind of information that Dr. Mridu has given in such a short time is precious. It's very good. You will learn it on the way, but don't stop there. That is my only ask. And we can do so much more with the integrated approach that and that is what will set us apart, and that is what will differentiate us. So I'm open to any comments, any suggestions, any questions. I think I've said what I've had to say mostly. So this is all that I was for today, a very basic teaser into what lies ahead in the conference. And we can talk more about it in the conference, of course. So over to Dr. Mridu now, and if there are any questions.
There are some questions, doctor. Let's have those few questions first.
Yes,
Dr.
sure.
What supplements you give, doctor?
See, again, the supplementation, all supplements, all good quality supplements with a decent clean base are good. I generally choose, when it comes to herbs, I choose single herbs, whole herbs. I don't use much of extracts. I choose supplements with minimum number of excipients, with clean excipients. So that is one rule. Supplements have to be customized. There is no one great supplement. So for stress acne, I would add magnesium. I would do something for sleep. So it is those who are Ayurvedic practitioners would know better and would understand better. For example, for acne, sometimes I use Brahmi, Centella asiatica, which works very well. It adds and aids in sleep for patients. So these kind of approaches are customized. So that is what we need to learn. That is what we need to train about, and that is what we need to put that protocol in place. Yeah. Individualized supplementation can be on the basis of gut microbiome testing. They can be on the basis of the Ayurvedic body type assessment. They can be on the basis of symptoms. If you're not interested in Ayurvedic medicine, or if you're not interested in following that protocol, then there is another protocol by which you can segregate patients of different types: stress-induced acne, hormonal acne, and then you can customize supplements as per those body types. So there are many tests for gut microbiome. There's the shotgun method. There are many other methods most companies are using. There are some very cheap microbiome tests available, which are giving you very minimum information. That is also okay. They are giving you only phylotyping. Then there are some more detailed gut microbiome testing, like my DNA labs and all. So what in my protocols, what I have made is we've tied up with all of this in one basket, and anybody who wants to use that protocol can use the entire protocol. Once the training is complete, you can feel free to use it. So there are many microbiome testings. What translates into an answer is what I recommend. So if I can interpret a dummy report and I can make out and tell the patient something tangible, he doesn't know whether H. pylori is raised, or bifidobacterium is raised, or acantobacter are raised, or the Salmonella species is raised, or Vibrio species is raised. That doesn't matter to the patient, and doesn't matter to the doctor also most of the times. What matters is how do you translate that result into a action. So that is where the role of gut microbiome testing comes in. What type of gut microbiome testing depends on the depth of your knowledge, and also sometimes the cost of the microbiome test. So there are that I hope that answers. Omega-3 and 6 supplements, see, there are, what my favorite product is Zinzino, Omega-6 and 3. They have a vegan option also. So whereby they have conjugated polyphenols with Omega-3 and 6. So polyphenols with omega-3 and 6 is very, very important with omega-3 particularly, because in nature, omega-3 is stabilized. It doesn't get rancid if it is combined with polyphenols. If it is lying without polyphenols, you cannot drink it. It will be rancid. You have to put it in a capsule and seal it up. And the dose of omega-3 is very variable. There are problems with omega-3 also. If omega-3 is given in a good 3-4 capsules a day or 4-5 milligrams, 4-5 grams a day, then you might land up in atrial fibrillation also. So all of those factors you need to consider when you are giving supplements. The same is with calcium supplements. The same is with magnesium supplements. So that is how we can customize. So this is a lot of my work is around nutrition and functional aspect. And dairy products really need to be eradicated. For most patients, yes. If you want to follow the evidence-based route, you do a gut microbiome testing and then you prove it, you change the microbiome, you see the change in 6 weeks. But yes, for most of my patients, as per my in-clinic data, we've analyzed 350 patients, whereby 82% patients had a significant improvement in their skin symptoms, be it acne or itching or urticaria, when they were on a plant-based whole food diet for 20 to 40 days. So I'm a big fan, at least to start as a detox, we do it often. So repeat in omega supplement. Omega supplementation for some people, if it is given in a dose of 3 to 4 grams, which is less than needed. We need 10 to 15 grams of omega-3 a day. So 10 to 12 ml of omega-3, 6, 7, 9, and olive oil, olive polyphenols. So the dose is much higher than we actually give. 1 or 2 capsules, 3 capsules a day generally doesn't work. If we are giving omega-3, 6 in a higher dose, some patients can land in atrial fibrillation. So that is a known side effect of omega-3, besides many other side effects of having heavy metal toxicity. It becomes rancid and it is inflammatory also for some patients, because if it turns rancid and it's not a great quality oil, it's not stabilized, then there are other challenges also. When can we see? Very, very fast. It is much faster than an antibiotic. How fast you can see results in that patient is extremely fast. I feel it is much faster than the patient if it is on antibiotics or isotretinoin. Okay. So vegan brand names, Zinzino is one. Otherwise, flaxseed oil you can use. You can just ask a patient to increase walnuts. I have an entire sheet on omega-369. If somebody wants, you can give me a text message. I'll forward you the entire sheet on which oil has how much omega-369 EPA DHA. And it is the source also from where we have taken the data I've mentioned in that. So walnut is good source. Ghee, contrary to the popular belief, is not a great source. So mustard oil is a very good cheap source. Walnuts are a good source of omega-3. So the ratio of omega-3/6 is also important, right? Because like sesame oils also has some amount of omega-3, but the omega-6 is very high in it. So it has other properties as per Ayurveda, and it is great for a lot of other properties, but sesame oil has more of omega-6. So I'll share it to you. Yeah, I can share it to you. I don't know how to share it on Zoom, but I can share it otherwise. Do we have to eliminate all dairy? Ghee, I will not count in dairy because the proteinaceous part, the whey part is missing there. So ghee can still be used. Again, these are all these are all things that we should learn in a structured manner, because any information I give in a short duration without understanding it can be very well mistaken. So I would milk, dairy is of course not a great choice for acne patients, even for aging. A2 ghee has benefits, of course. So again, we need to discuss. There are many things. There is nothing like A2 and A1 ghee. When the protein component A1, A2 is a protein. If the protein component is taken, how does it matter what ghee it is? Right? It is just saturated fat. It is good. I use a lot in my practice also. But you have to use with awareness, and you have to learn. We have to really learn the finer nuances of nutrition and how to customize it. We have to give it a lot of time, attention, and our conviction. If now I am convinced in past 15 years of managing that with this 5-point agenda, fasting, feasting, straining, sleeping, and customized supplementation, I can manage almost everything. And you will not believe it, if I am seeing 30 to 50 patients a day, in my pharmacy, I don't carry isotretinoin. I don't dispense an antibiotic. I don't dispense isotretinoin. I don't dispense itraconazole. I don't dispense terbinafine. If I'm seeing 30 to 50 patients a day, I have a skin pharmacy going on, but these four things, I don't keep them in my pharmacy because I don't need them much. So that is the level of my conviction. And if as physicians, you are able to get a hang of this, is what will differentiate you from your competitors, because everybody is skilled. To the patient, it really doesn't matter how much, a little bit of skill up and down doesn't matter. More or less, everybody is at the same level after a point of injecting. More or less, everybody achieves a certain level of skill. What matters to the patient is whether you are giving them what they need. They don't know what they need. They know what they want. They come to you for what they want. You give them what they want, doesn't make a difference. You give them what they really need is the job of a doctor. And you give them what they need cure, they need understanding, they need empathy, they need compassionate care, and then you're sorted. That is what will differentiate you. You don't need to take a course, Dr. Sunita. This is a very common question I see. For naturopathy and Ayurveda, you don't really need to take a course. You just need to build an approach. As a MBBS doctor or as a trained doctor in any specialty, BAMS, BHMS, BDS, in any specialty, if you're a trained doctor and you have an orientation to the basic biological sciences, physiology, then there is a lot that you can build up on it functionally. You can, when I train in for particular indications, then we will talk to you about all of these aspects also, how to integrate Ayurveda simply, basically, in your care. We have an app also, so that's upcoming. So you don't really need to invest much energy and much skill, but you need to develop an intent to be able to incorporate and to be able to see, because your eye will see only what the mind knows. If your mind knows that there are different body types, and there is a pitta body type, and there is a kapha excess, there is a kapha avaran, then you would catch it and then you would treat it easily on your own. So no need to invest in too much of a time and course for that. But yes, when I do train, I do talk about it. And I do give you very simple aspects whereby you can practically and on the ground integrate it in your OPD without doing a long exam. Collagen supplement for vegetarians. See, any protein, any good protein, proline, lysine, valine, if you're taking, is good enough for building collagen. You need to have the precursors. It is like asking what protein to take for vegetarians. So if you're on a decent protein diet, and you have the cofactors and the minerals and the copper and the enzymes, then the body will make collagen. But what I tell my patients, drinking protein powder has no guarantee of giving you muscles. To get muscles, you need to have many other things other than protein also. You need to exercise. So if my diet is glycated diet, high carb and high sugar diet, how can I expect my collagen to be better? Can't. It's very simple. Then somebody will come and sell you carnosine collagen. Add carnosine with collagen and that is better for glycemic control. It is not going to work till you change in the ground. Again, it comes back to the 5-pillar approach. So there are, of course, many collagen supplements available for vegetarians. Those are collagen precursors. So no harm in using those, but I don't really see the need and the great response. I have not seen personally in my practice. But there is a lot of hullabaloo about collagen supplements. I personally don't use them because most people's gut health is not suited well enough to add another processed food to their diet. As it is, the processed food intake is very high. So that is my take on collagen. I use, but very, very little, hardly. Sir, nutrition with scientific and ancient Ayurveda regarding weather, body type, Vata Pitta with genetic interference also. I didn't get your question, Shiny. Where can we connect you on social media and other platforms? You can look up Dr. Aman Sharma, or Dr. Mridu can share the number, or whatever ways you can connect with me. You can have my personal number. and connect with me wherever, whatever queries you have. So that is my only approach, is to have, in short, to have a brand whereby you can use in your clinic for treating. For example, if you want to add a stress management clinic in your clinic, so you have a stress management clinic in your clinic whereby you can give that option of stress management, of psychotherapy, of counseling, of psychiatric care, of everything that comes for stress management, including breathing, yoga, meditation sessions, online, offline. You can begin a service in your clinic. If you want diabetes reversal program in your clinic, you can put that service there and you can start. If you want only a soft lift plan in your soft facelift, that is non-surgical facelift, in your clinic, you can begin that. If you want only acne clinic, clinic in clinic concept, that you can get started, which differentiates you from anybody else doing the same thing in your neighborhood, because you would be giving an holistic and integrated approach whereby you would not just be using your skill which everybody has, you will also be using the overall global approach which your patient will love, which is what will give you the word of mouth and the loyalty that all of us want from our patients. I hope that helps. And we've really shot over time, Dr. Mridu.
No
I think
problem.
I'll hand it over to you now.
Wonderful, wonderful session. Truly loved it from the core of my heart. Thank you so much.
Thank you.
It was really enlightening session because being doctor, acne का treatment आया तो antibiotic तो by default लिखना ही लिखना है, isotretinoin तो देना ही देना है. So hearing from you that in your clinic you are not dispensing tretinoin and antibiotics is truly commendable. And the way you are mixing the modern science with our roots. Naturopathy is all about our roots, and you are treating all that, the 5 P's which you're told, wonderful, the feasting, the fasting, everything you were telling. I could really relate that. And I'm sure your patient must be loving you for all that. Because patient का पहला concern होता है, मैम एंटीबायोटिक मत लिखना, एंटीबायोटिक मत देना, और आइसोट्रोटिनॉन तो मेरा बच्चा कब से खा रहा है. प्लीज आइसोट्रोटिनॉन तो बिल्कुल मत. दे ऑल नो द ब्रांड नेम्स ऑल्सो. दे नो व्हाट कितना mg देना है, 10 mg, 20 mg, 30. दे नो एवरीथिंग बिकॉज गूगल हैज एवरीथिंग. सो दे आर वेरी वेल अवेयर कि ये देना है नहीं देना. सो दे पहला क्वेश्चन यही है, मैम एंटीबायोटिक तो नहीं दोगे, आइसोट्रोटिनॉन तो नहीं दोगे. So if we can skip that from our treatment, it's going to be
Just to give you even more precise data, Dr. Mridu, in 2 years, in the past 2 years, I have 8,000 odd registrations. In those 8,000 odd registrations, we have used isotretinoin only in 6 patients.
Wow, wow, really
So just to
commendable.
give you a very precise.
Very nice.
Yeah.
Great, sir. It was
It's
really
not needed.
wonderful.
It's not needed. Yeah.
So I think we'll be having much more details about this in our conference. That is the Facial Aesthetics and the Cosmetology Conference, which is going to be held on the 3rd and 4th May. So anybody who wants to have a selfie with Dr. Aman Sharma can please come and join us on the FECON, and you can have a direct face-to-face interaction with Dr. Sharma there. And he's going to deal with much more details than he did cover today. So looking forward to meet you all on in the conference at Pashchim Vihar, Radisson Blue. So looking forward for much more interactive sessions. Thank you, sir. It was lovely having you with us. Any questions? Great, sir. Thank you so much. Thank you. So it was a pleasure for us when Dr. Sharma has joined us, and great interactive session. So now one of the topics has left. So if you people are not tired, or do you want a stretch break, you want to break for a minute or so, I can give you a stretch break and then we can continue with the session. Or if you want that session to be held in the next webinar, we can do that. So just write in the chat box if you're interested for the next session, which is left on the one of the topics which is left. So if you want, yes, great. Dr. Anchal, full energetic, very nice. Dr. Soumya. Okay, great. There are so many yes, very nice. Let's see how many people are woke up. How many people are writing yes. Okay, Dr. Rupali, yes, great. That's so nice. So that shows how people are hungry for the knowledge. Very nice. Dr. Angel, Dr. Mariam, very nice. Let's have a stretch break also till the time people are writing. Let's see how many people are interested. That's great. Okay, so we are going to have it. Great, great. Okay, till the time we start with our session, with our next session. So I would again like to invite you for the facial aesthetics and the cosmetology conference to be held on 3rd and 4th May, Saturday, Sunday. So wherein we are going to have lot more speakers with us. So Dr. Stefania is coming from Italy. She's going to cover the micropigmentation session. So those of you who are having challenges, those of you who are having challenges in treating your scar patients, in treating the you can say those marks, the marks which people get on their wrist, जो self harm marks होते हैं. So if you want to treat the vitiligo, or if you want to treat anything like stretch marks with the micropigmentation, so she is the trainer in micropigmentation with scalp also. Share कर दिया उसने. So she's going to give all the insights and some hands-on during the conference. So she's going to be there. Then there is going to be a session on NAD. So NAD is an ultimate solution in anti-aging. So those who want to learn and want to have the experience of NAD, want to know the details of NAD, how it is going to affect how it is going to change the aesthetics, how it is going to change the treatments are being done. You all must be doing glutathione. So it is far above the glutathione also. So the complete session on the NAD we are going to have there. And then we are also going to have again anti-aging and anti-acne clinic set up by Dr. Aman Sharma, who was just here. Then we also have a complete trichology session, which will have 3 live demos, like how to test for the minoxidil, how to test for the androgenetic alopecia, how to go for the autologous exosomes. So all these live demos will be there during the FECON. And also there'll be a complete session on the gene biohacking therapy again. And there'll be also a session by Dr. Sayyam, who is a MS in surgery, and he will be giving a session on the minimally invasive things in your practices, like how to treat the lipoma, how to treat the cyst, how to treat the torn earlobe, how to give all these minimally invasive surgeries in your clinic to your patients. So all those minimal things which you can treat in your clinics without much of the scalpel. So that all those he's going to guide you during the FECON. Plus, we have lot of interactive sessions, lot of hands-ons, lot of stalls by the people in the industry who are coming up with the new things. So it's going to be a very fun-loving, very interesting sessions. Last year also we held this session in May, and now after a year we are coming it again with many more speakers and with much more enthusiasm. And there also you will also have a award session wherein we have lots of prizes, which I have already told you. Plus, all of you will be getting a souvenir and a certificate from the guest speakers. So looking forward to see you all. The registration fee is for the 25 speakers left is only 7,000, and then it is going to be increased after the number is crossed, that 25 number is done. So then it is going to be increased, and the registration link is already there. And Akshita, please put the link in that. So if anybody interested can put up, can do the registrations right away, because only 25 slots are left, which are with this fees. And this is a fees which includes your both days high tea, both days breakfast and the lunch on both the days. And if somebody wants to have more interactive session, yes, Dr. Sunita, this is in Delhi on 3rd and 4th May.
9,500 is dinner plus.
Yeah, if you want to enroll for the dinner also, so dinner is going to be a complete networking event wherein you are going to make new friends, new colleagues, and for those, and you are going to meet those people whom you have just interacted on the chat, because we have made a group on the WhatsApp group on the WhatsApp also. So I know many people who made friends, who met colleagues during these webinars only, and they interacted in my group only, and they are now more than friends. So now you are going to have a lovely time with them for 2 days. And while you will be interacting with all the speakers, with all your colleagues, and you will be served well by the host, for your hospitality also, we are going to give you complete both the days, lunch, morning tea, high tea. So don't worry about that. Just sit, relax, just come for 2 days, leave everything aside when you come for the conference. Yes, Dr. Jagmeet, it is 7,000 for 2 days. That is in the Paschim Vihar, Radisson Blue. So looking forward to meet you, Dr. Jagmeet. Dinner is separate. Dinner is 2,500. So whoever wants to join for the dinner has to pay 9,500, and whoever is not coming for the dinner can pay only 7,000 and get yourself registered. Somebody is asking for the injectable courses. So injectable courses is right after the FECON. This is on 6th and 7th and 8th. And if somebody wants to learn all those detailed course in micropigmentation, wherein we have scar micropigmentation, where we have tattoo removal, tattoo scarring, or we have lip neutralization, even the brows. So everything will be covered by Stefania Venera and Tanishka and me. So all three of us will be there to handhold you for the micropigmentation. Okay.
For the course, yes.
Yeah. For anything else, every assistance will be there in the group. Akshita will be there to chat with you. You can ask her any doubts you have. The timings will be from 9 morning to 5:30, and the timings for the dinner will be around 8:30. So I think everybody of you should join, because we have already been meeting all these webinars. हम बात कर रहे हैं, हम एक दूसरे से देख रहे हैं, but meeting in person gives you an extra level of edge, कि आप जितना मिल के आप बात कर सकते हैं, जितना मिल के आप अपनी opportunities को और ला सकते हैं. So that's going to be a great thing. So now let me share my screen. Link is not working for you, Angel. How come link is not working for you? Look, Akshita, can you just check? आपने वही रेजर पे वाला ही दिया ना?
I've shared it on the group as well, if anyone wants to.
She is shared in the group also, if you can see.
To pay with this.
यहाँ पे दोबारा डाल दो एक बारी. There's a scanner also sent here.
In the group.
यहाँ पे भी डाल दो.
मैं डाल-
If they are having trouble. Okay, so I'm just sharing my screen. बोल दिया. Okay. So last week we had a session. We had a webinar on exosomes. So exosomes is a newer kit which has come on the block, and the exosomes which we have studied, they come under the autologous regenerative medicine. And today we are going to do specifically the exomine. So every day new things are coming in the market. So it is my passion to teach all my doctors who are in touch with me, to keep them updated with whatever thing is coming in the market. So I make it a duty that what I know in the industry today, so every doctor who is in contact with me should know that. So that is why I thought this product which has come up, the exomine, should be shared with all. So that is why I'm here with you. So autologous regenerative medicine, just a minute. Minimize that. Okay. So autologous regenerative medicine is any treatment that uses a patient's own biological material. It could be blood, it could be fat, it could be skin cells, to stimulate your tissue repair and regeneration and rejuvenation. So unlike synthetic or the donor-based treatments, autologous therapies minimize the risk of rejection, allergic reactions, or infections since they come from the patient's own body. So now when we did exosomes, so we have sent, when we have done the exosomes, we have seen that exosomes can be plant derived, they can be animal derived, or they can be derived from your own body. So we also discussed in detail the exosomes which have been derived from the salmon fish. There are exosomes which have been derived from the aloe vera. There are exosomes which have been derived from the rose plant. But somewhere we have seen the side effects also, like being a foreign body. Some patients had some problems like the lymph node enlargement or some other problems. So to decrease those side effects, we have come up with the autologous regenerative therapy like exozyme. So this is a new thing which has come up in the aesthetics. So we have screenshot, slide share. So under the regenerative medicines, we have been doing a lot, like we have all been doing platelet-rich plasma therapy. So everybody has been doing PRP for the face, for the skin, but the only disadvantage of the PRP has been that there is no gold standard treatment for the PRP. Everybody is using a different machine, everybody is using a different centrifugal force, everybody is using a different radius, and everybody is using his or her own time to make the PRP. So though that is not a gold standard, that is why GFC had come, then the PRF has come. So PRF is a second generation PRP with a higher concentration of growth factors and stem cells. There are again special tubes for it, special machine for it. Then after that, there came the autologous fat transfer, which can be injected along with the stem cells. Then the exosome therapy is the new thing. Then after that, another new thing is the fibroblast therapy, which is the autologous cell harvesting. And then other things, the indications where all of these have been used is like, first of all, in the skin rejuvenation, in the anti-aging, because it stimulates the collagen and elastin production, improves the skin quality, reduces the fine lines and wrinkles. Then in hair restorations, the PRP and the exosome therapy have been used. We have been using them for the scars, for the wound healing, along with the microneedling. Then also, they also help in the facial contouring, volume restoration, then also used in the post laser and post procedural recovery. Because all these therapies, they speed up the recovery after the laser treatments, microneedling, and the chemical peels. And all of these are gaining popularity because they are natural to use. They use own patients' own cells, reducing the risk of complications, and they stimulate the natural tissue regeneration rather than just providing temporary correction. And multi-benefit approach because it works for skin, hair, scars, and the volume loss. And also it has minimal downtime. So exomine is an autologous platelet-derived thing which is being used for the skin as well as for the hair. So there is a kit which facilitates the release of billions of vesicles of exosomes by stressing the platelets and a minimal amount of the other blood cells within the PRP, and simultaneously through its special protocol and devices, it activates the platelets, providing a plasma rich in platelet-derived exosomes. So exomine, with its broad applications in aesthetics, used in ortho also, used in therapeutics also, it proves to yield effective results in various fields like skin regeneration, hair loss treatment, spot treatments, joint disorders, connective tissue disorders. So a lot of things it has been used in lot of the therapies, lot of the therapeutic treatments. And as we know, the exosomes. So let me just show you how it is done first, and then we will come back to these slides. So you can just have a look at this video. So you have, do you know Naresh? So you have seen that a punch biopsy has been done. 3 points of punch biopsy has been done, and that tissue has been taken in one of the syringes, and in another syringe, the normal saline has been taken, and with the kit given, which is a circular kit, which is like a filter. So in that, this tissue is being moved. So that is called causing the mixing of the two things, the saline and it is also causing the meshing up of the product which we have taken with the help of our punch biopsy. So then we have another filter, which is 150 microns. So you can just see. So now we are again putting both the syringes on either side of it. So now we have seen the video, so the concept is little clearer in your mind. So Exomine kit facilitates the release of billions of vesicles by stressing the platelets and a minimal amount of other blood cells within the PRP. Simultaneously, through its special protocol and devices, it activates the platelets, providing a plasma rich in platelet-derived exosomes. So Exomine, with its broad applications is aesthetics. We have talked about various. It has been used in hair loss treatments, spot treatments, joint treatments, connective tissue therapies. So in the vesicles, it has a lot of mRNA. So mRNA helps in transferring the genetic information to the target cells. So all these exosomes, what do they do? So they have been released from a parent cell and they go to a daughter cell uh, and they go and act on the genetic material. So now, as we talk that exosomes daily ki hum exosomes ki baat kar rahe hain, so what are exosomes actually doing? So exosomes are going to affect the genetic mode, genetic medium जो है आपका, जो न्यूक्लिक एसिड है, जो आपका डीएनए है, जो आपका प्रोटीन अंदर है आपके सेल्स के अंदर, उसको जाके मॉडिफाई करेगा. जैसे कि हमने देखा exosomes have been obtained from the salmon derived DNA also. So the DNA of the salmon is very close to the DNA of the human. So that is why whatever breakage is happening in the cells, whatever DNA is being destroyed, and this is not helping us in the skin rejuvenation or in the hair therapies. So exosomes go and repair that DNA, become a part of that DNA, and it brings about the changes in the genetic material. So all these power packed molecules or the messengers, I would say, they contain in them the mRNA, the miRNA, and some proteins which provide intercellular communication. एक सेल में बना, एक सेल में इस तरह बना कि जो भी एक्स्ट्रा सेलुलर मटेरियल था उसने उसको अंदर लिया. जब वो अंदर गया सेल के तो दैट बिकेम एन एंडोसोम. अगर वो कुछ जो इसके एंडोसोम के अंदर प्रोटीन है या मटेरियल है जो इसके काम का है, तो दैट विल बी रिलीज्ड एज एन एक्सोसोम and will be delivered to the another cell. So that is going to do the modulation of the gene expression in the other cell. But if it is of no use, so then it is going to be phagocytosed by the cell. So if it is being used and this is transferred to the other cell in the form of exosome. So in the Exomine kit, we have these kind of filters. One is yellow filter, one is red filter, and this is also known as the microlyzer blade technology. So microlyzer 600 micrometer with its specially designed blades and structure induces the stress on the blood cells, leading to the release of billions of vesicles. It also plays a crucial role in the activation of the platelet cells. And T-Lab, through its collaborative efforts, T-Lab is a company which all of you must have heard. It has its special PRP tubes. So with its special internal design, it produces those filters. And with that special internal design, the product facilitates the release of billions of vesicles, activation of the platelet cells, and settling of a very small amount of the other blood cells in the pellet. And it is very safe and effective because it is autologous. There are no chance of allergic reactions, and it has evolved through years of extensive research and development driven by T-Lab's expertise and reliability in autologous systems, has been tried on mice and other things first before coming to the human trials. And it is offering rapid and effective outcomes. Exosamine, it provides users with an autologous and secure system. You are sure that ki jo aap product use kar rahe ho is not going to cause any allergic reactions. And many times patient will tell you, I don't want any foreign thing on me. मुझे कोई filler नहीं कराना, कुछ botox नहीं कराना. Give me something which is from my own body. So this is a wonderful product to be used from your own body. And because there are billions of vesicles, optimum size which they have high vitality, and the approximate count of 35 to 40 billion vesicles per ml has been there when a research was done. And with a final product size of approximately 5 cc, Exomine delivers an industry-leading vesicle count, which is 120 to 150 billion vesicles. And to be defined as exosomes, vesicles need to have sizes ranges from 30 to 150 nanometer, and that is what the Exomine is having. And the laboratory results further demonstrate a viability rate of 99%. So areas of application, you can do them as you do them with any skin booster or with any PDRN, which we have been doing. All of us have been doing, most of us have been doing that. And this is frequently employed in combinations with skin and fat tissue. It can be combined with the skin and fat tissue to facilitate the soft tissue healing, to enhance the regional tissue quality, to achieve the tissue radiance, all of those things to improve the wrinkles, to address the hair loss, and particularly used for skin rejuvenation, wrinkle reduction, as well as in the treatment of stretch marks, spot issues, and also promotes the thickening and volumizing of the hair follicles in the affected area, aiding in root growth, making it a common post hair transplant procedure. And also, in wound care, Exomine yields successful results in situations where surgical options are limited or having a low success rate, such as wounds due to vascular insufficiency, trauma-induced wounds, or diabetic ulcers. So all those wounds where the healing is very slow, so it is helping in that also. And it has been used in ophthalmology also for the dry eye syndrome and many other corneal ulcers, etc. Plus, in oral and maxillofacial surgery, Exomine is effective not only in the soft tissue but also in stimulating the bone and the hard tissue. So it is clinically utilized in various areas from gum tissues to jawbone osteonecrosis. So it's a great product for most of the audience who is sitting here. And the indication wise and the protocol, it has to be used mostly in hair loss. It has to be used single session. Uh, you can just take a screenshot of this. It can be used for the skin rejuvenation, scar treatment. Sometimes in all of these, single session will also help. Otherwise, PRP can be combined after 2 to 3 weeks, and then Exomine itself can be repeated after 3 months. And the first effects start to appear within 21 to 27 days after Exomine injection, and the effect lasts for 6 to 8 months after protocol applications, and it is recommended to apply Exomine as booster dose every 8 months. And beautiful thing about learning is that nobody can take it away from you. Thank you so much for being here for almost 3 hours. I really appreciate how much passionate about you are about learning. So I hope the learning session was good for everyone. Everybody enjoyed. Any questions, anything you want to ask, you're most welcome. Let me just stop the screen share. Thank you, Akriti, and congratulations, Dr. Angel, because you are have been registered for this. You have just registered. Thank you so much, and congratulations also. And looking forward to see you. Biopsy instruments are the punch instruments. Zoom user, I don't know your name. Thank you so much. Thank you for the appreciation. Cost per session, the cost has not been revealed to us. Even I have not had a hands-on experience for this, but this was a new topic to me. So I wanted to introduce this topic to you, all of you. Dr. Sim, precious knowledge. Thank you so much. Dr. Priyadarshini, thank you. Prices we don't know even. Divyangani, very informative session. Thank you so much. Dr. Kriti, most welcome. Harinder, always wonderful with you, ma'am. Thank you so much, Harinder. Looking forward to see you in FECON.
The
And
recording will be shared till Monday
we'll try to share the recording in a day.
for 2 days.
That will be available for 2 days. Dr. Goeska, thank you for giving so much knowledge. Thank you. Thank you so much. Angel, you were late in session because of the patients, but very interactive session. Thank you. We are looking forward to meet you. And thank you for enrolling also. And punch biopsy size, you can use the normal punch biopsy sizes which come. There's not a hard and fast rule which size to be used. Normal punch biopsy, any one can be used. Thank you, Dr. Soumya. Such a great session. Thank you. I think we'll be able to give you the recording in a day. Thank you so much. Lovely interacting with all of you. I hope to see you soon again in the next sessions. We are going to keep such sessions soon. And anyone wants to have any topic in the next sessions, you can all put down in the group. So you can put down in the group what all you want to learn in the coming sessions. So we will be having a lot of sessions in the coming weeks. And we look forward to see you in the FECON also. And thank you so much. Great interacting with you all. Bye-bye. Thank you.